Hola, muy buenos días y bienvenidos al
Hello,
webinar
everyone, and welcome to this webinar of PAHO for the International Childhood Cancer. I am chair of the OPS, non-transmissible diseases. So I want to welcome to this webinar from the OPS in Washington, D.C.
Welcome to the PAHO webinar for International Childhood Cancer Day. I'm Silvana Luciani from the NCD program here at PAHO from Washington, D.C., and it gives me great pleasure to welcome you all to this very special webinar that we have today. And we will be delivering the presentations in English and Spanish, and we have simultaneous translation for you. You simply need to click on the language of your choice at the bottom of the screen in the interpretation globe. Es con mucha emoción que nosotros desde la OPS estamos.
We are very excited that we have this regional webinar of the evidence to action, that is tools in order to improve the childhood cancer care in something that we call CureAll Americas, and with a collaboration between PAHO and St. Jude Children's Research Hospital. Today we have a pleasure to be able to present a new technical regional package from the PAHO that includes guidelines and tools that are very operational in order to improve care for children with cancer. These tools will be available in English, Spanish, and Portuguese, and we want to show you the whole package that we have available in order to improve the access to medication and also to strengthen the transplantation programs, to help all the survivors, and also to reinforce the psychosocial care for their families and their patients. So we are very excited because we have here all the collaboration of our friends from the regions. We have the Academy, pediatrician, oncologists, our colleagues from St. Jude, ministries of health. And the truth is that we want to promote this regional collaboration and to promote the use of all these excellent resources that we have prepared for you. So
all of you together here, key leaders, stakeholders, those responsible for childhood cancer care in the ministries of health across the Americas region, to talk about childhood cancer, how we can improve care, and to launch this new package of technical resources for childhood cancer. And we have a very exciting and full program ahead of you. And to start us off, we will have some welcome remarks from the Director of the Department of Non-Communicable Diseases and Mental Health from PAHO, from Dr. Anselm Hennis. So we turn now to the welcome remarks from Dr. Hennis.
Good morning to all colleagues, partners, distinguished representatives from ministries of health across the region, technical experts and collaborators from national and international organizations. On behalf of the Pan American Health Organization, it is my great pleasure to welcome you to this webinar held in collaboration with St. Jude Children's Research Hospital. I want to thank St. Jude for their long-standing leadership and for joining us today to advance the shared vision, ensuring that children in our region have access to diagnosis, treatment, and quality of care. Over the past biennium, the region of the Americas has made tangible and measurable progress in advancing childhood cancer care through the Global Initiative for Childhood Cancer, translating evidence into concrete action across countries. At the policy level, more countries than ever before, and to give you a sense, from 6 in 2017, increasing to 14 in 2025, have adopted national childhood cancer policies and plans, particularly strengthening early diagnosis frameworks, one of the most critical determinants of survival. These policy advances reflect growing political commitment and alignment with global standards, while remaining firmly grounded in country realities. We've also seen concrete improvements in early diagnosis and outcomes, with countries reporting shorter diagnostic timelines, with up to a 50% reduction, and fewer children arriving for care with advanced disease. These results confirm that investments in guidelines, training, and system organization directly translate into lives saved. Equally important, the region has strengthened its technical and institutional capacity. More than 120,000 health professionals across the Americas have been trained in priority areas such as early diagnosis, pediatric palliative care, safe chemotherapy, and hematopoietic stem cell transplantation, laying the foundation for sustainable, high-quality services. During this biennium, we also consolidated a comprehensive regional technical package for childhood cancer that will be presented today, and it's composed of 93 publications in Spanish, English, and Portuguese, bringing together technical documents, guidelines, courses, and operational tools. This package moves us beyond fragmented interventions toward an integrated approach that supports countries across the full continuum of care, including survivorship and psychosocial support for children and their families. Finally, through the Global Platform for Access to Childhood Cancer Medicines, as a partnership of St. Jude Children's Research Hospital, WHO, PAHO, and UNICEF, access to life-saving medications has expanded, with hundreds of children and adolescents receiving timely, quality-assured treatment, and regional scale-up already underway. Today's webinar reflects this journey from evidence to action and offers countries practical tools to continue transforming commitment into impact for children and adolescents with cancer across the Americas. The discussions today will provide a roadmap for countries to accelerate progress, strengthen national plans, and adopt these essential and expanded packages as part of their path toward our common goal of increasing survival rates in childhood cancer, coupled with improved quality of life. I want to thank our invited speakers for their leadership and expertise, and I want to thank all of you for your commitment to improving childhood cancer care across the Americas. I look forward to a productive and inspiring session. Thank you, one and all.
And thank you. Those were kind welcome remarks from Dr. Anselm Hennis, Director of the Department of Non-Communicable Disease and Mental Health. Thank you, Dr. Hennis, for all the support that you give to us and to this great childhood cancer control community that's working hard to improve survival rates for children with cancer. Bueno, vamos a empezar para primero presentar todos los recursos que tenemos disponible. Y
First, let me show you all the resources that we have available, and let me just welcome all of you who have just connected to this session. We have our friends from the Americas. We have a lot of friends here, and we are so excited to be able to show you all the available resources that we have for treatment, care, etc. And in order to be able to start this, we will have our Dr. Liliana Vasquez. She is the technical officer for childhood cancer in the PAHO. She's working for the Americas together with the doctor from St. Jude's Hospital. She's also working together with us to be able to promote and produce this tool. So over to you, Liliana. Hello, everyone, and thank you for connecting. This is a very excited moment for us from the PAHO and also with our friends from St. Jude's and all the strategic alliances that we have. This is a very special day for us. And as you know, it was on February 15. But we want to move forward with this work that we have all together and to work with adolescents and children in the region. We are very happy because now we can show you all these available resources so that the quality of care in children is improved. Let us remind you that this is a very important problem. I think that many of us, all of us who are interested in this topic, we want to move forward together to change the reality that we currently have, that every 18 minutes, a child or an adolescent will be diagnosed with cancer in Latin America and the Caribbean. Out of these, we know that half of them will die due to the disease, and most part of this mortality cases can be preventable. And also in child cancer, we can work with the causes, and most of them are related to a late diagnosis, lack of adherence to treatment. So this is why it's so important to recognize the things that we can do today to help our patients. Within this framework, then let me tell you that this is a global strategy that we have implemented back in 2018 and in a region 2019 in order to be able to increase childhood cancer survival and reduce suffering, to improve quality of life, and that they feel that they are here for them, that all the communities there for them. Currently, we have 19 countries that are part of this network for CureAll Americas. 11 countries are right now implementing the project, and each one of them represent a project, an intervention that is led by the Ministry of Health and the hospitals that are participating, foundations, the scientific community. We have 95 national projects and 78 at the regional level that now we are monitoring by this initiative. But the most important thing is to be able to see where are we heading towards, what are the challenges that we have. And 5 years ago, more or less, six, we decided that we wanted to address one main challenge: timely diagnosis. This is a critical point in order to be able to improve survival. So we knew that the numbers by 2018 were very concerning. Close to 20-30% of all the cases will not be ever diagnosed. And half of these children will arrive into advanced stages, and prior to 2018, only 4 governments had public policies for timely diagnosis. So how can we address this diagnosis with patients? And this is why, together with our colleagues from St. Jude and many other strategic partners, we decided to entitle this webinar "From Evidence to Action." How can we convey all the knowledge of all this situational diagnosis and all the progress that we have and the information, and to translate this in public policies that really cause an impact, that will really get to patients, and to work on a framework of this initiative with timely diagnosis and suitable complete treatment and quality of life. These are multiple projects that are led by countries. Us as PAHO and St. Jude and also other strategic partners, we capitalize all the efforts, but each one of these projects that we will see in a minute, all of these initiatives are led by countries that are part of this challenge. So what we have achieved altogether, well, let me just give you an example. This is so important because many of us who are here present, I'm sure that you are passionate about this. We've managed that close to 12 countries now already have standards and guidelines for diagnosis, early diagnosis, and this has tripled in the last years. And this is not for free, you know, that a country or a government may prioritize childhood cancer and also to use it with other problems of health, but to give the space and the visibility that corresponds to childhood cancer in our governments. And also, examples that I believe are very important, that is the example of Peru, that in the last years they've managed to decrease time to diagnosis in more than 50%. Also Panama, where we can see that they have managed to move forward against advanced stages of disease, the disease in 50%, and we see numbers going down. So how can we get close to the public policies and to the reality of our patients? Now, this means that we need to work together to have results and tangible results. So this is why we are presenting this technical comprehensive package, and we are so proud of this. We've built this for so many, months, and we work with many of you, and it has three components: early diagnosis, also complete treatment, and also support and quality of life. Each one of these components have resources that are there available for you, for the countries, and they of course can be improvable, they can be adaptable, and we can always share this between everyone who may need it. We also have, for example, the primary care training strategies. We have more than 150,000 participants. Also communication and awareness strategies, campaigns, guidelines that we are developing in the countries, and also the updated 2025 guideline early diagnosis of childhood cancer of PAHO and WHO. As part of this component, we have the training strategies for example, training. We have virtual, face-to-face. We have these webinars in order to be able to have a very important project that is the hematopoietic stem cell transplants, and also we develop technical guidance that can be used by all the professionals regarding nutrition, management of oncology nursing, pediatric chemotherapy, nutrition, oral care, etc. And this is very important also to have access to medication. This is an initiative led by the PAHO, St. Jude, UNICEF, and the World Health Organization in order to guarantee essential medication for kids with cancer, with children with cancer. We work together with two countries right now that are implementing, and we have more opportunities so that we can have more countries joining us. And also we have another component that we have, for example, materials regarding psychosocial care. We're going to hear more about all this, pediatric palliative care, but the idea is not to be there for the patient or to their families, but also the professionals, the health professionals, and also that they work in a multidisciplinary manner in order to be able to comply or to fulfill our mission. This technical package has 93 publications, and we have more than 200,000 professionals that they've been trained, more than 128 downloads. It's available in English, Spanish, and Portuguese, and in there on the chat, we're going to be able to share with you the link of the webpage that it has been recently designed and improved so that you can have access to all these resources, and they're there for you, and you can use them so that countries and mainly patients can be benefit from this. And with this, I pass the floor to our dear Soad Fuentes.
Gracias, Lili. Un placer estar aquí con ustedes en este día tan especial en que celebramos la vida de cada niño, niña y
It's such a
adolescente que
pleasure
lucha contra el
to be
cáncer
here.
infantil.
We're celebrating the lives of children and
Mi
adolescents
nombre es Suad
fighting
Fuentes Salaví, ya todos me
child
conocen.
cancer. I'm
Actualmente,
Suad
ahorita
Fuentes,
estoy como
Tel
directora
Aviv. You'll know
regional
me. I'm the
para los
regional
programas de México,
director
Centroamérica y
for
Caribe con St.
programs
Jude
in
Children's
Mexico,
Research Hospital.
Central America, and
Y
the
es un placer
Caribbean.
acompañar siempre esta
It's
colaboración con
such a
St. Jude.
pleasure
Como
to
ustedes saben un poco de historia, toda
engage in this
gran
collaboration
transformación
with St.
comienza con una
Jude's.
convicción
As you
profunda.
know, every great transformation starts with a
Como la
profound
que dio
conviction.
inicio este sueño
Such
de
as
Danny Thomas en
how
1962
Danny
cuando
Thomas's
fundó
dream
St. Jude Children's
came
Research
true in
Hospital.
1962 when
Y
he founded the St. Jude's
ser tan
Research
especial dio origen a una idea que
Children
cambió la
Hospital,
historia del cáncer
which
infantil. Y es en
gave
ese
birth
momento
to a
que
change
el
in
cáncer en la
history
niñez y en la
for
mayoría de los casos,
children's cancer.
en esa época, era una sentencia de
Back in the
muerte, al
day,
igual que lo que
cancer was
sucedía en
a
nuestros países.
life sentence
Pero
all over the
para
world.
Danny Thomas, que
For
tuvo esta
Danny
visión tan
Thomas,
poderosa y
who had
clara,
such a
era de que
powerful and
ningún
clear
niño
vision,
debería de morir en el amanecer de
no
la vida.
child
Esta frase no es
should
solo una
die.
inspiración moral, sino es un llamado a la acción
In
que ha
the
guiado más de 6 décadas de investigación,
dusk
atención
of
y
life,
fortalecimiento del sistema de salud.
this is how the
Hoy esa
healthcare system
visión
has strengthened.
se convierte,
That vision
¿verdad?, en una misión que significa lograr que los
has
avances
turned
en
into a
la
mission.
cura y en la prevención de
And the mission
enfermedades
is that
catastróficas de las niñas
advances in
a
cure
través de la
and
investigación y el
prevention
desarrollo de tratamiento encuentren
of
una esperanza
catastrophic
de vida.
diseases during
Y
childhood through
esta
research
misión
and
se traduce en la
development of
visión,
treatments.
la
This
cual es
vision
inequívoca de que cada niño diagnosticado con cáncer o
is
con
that each
trastornos
child diagnosed with
hematológicos
cancer
pueda tener acceso a
or
una atención
blood-related
de calidad sin importar
disorders
el
will
país
have
donde viva.
quality of care,
La que
regardless
sigue.
their place they live.
Esta visión se traduce en una alianza global sólida y
A
que va en
solid
crecimiento
global
y
alliance was
que
created.
funciona como una
It
verdadera
keeps
comunidad
evolving and it
internacional de
works as a
aprendizaje y
true
acción.
international community
Actualmente, la
devoted to
alianza
learning and
global
action. The
tiene
Global
más de
Alliance
290
has over
instituciones miembros
290 member associations
firmadas en más de 65
in
países y
over
la cual se
65
continúa
countries.
extendiéndose
The
con nuevas
network keeps
instituciones
on growing
solicitando en
with
todas las
new
regiones.
institutions
Adicionalmente, este
who want to
crecimiento va
enroll.
acompañado
This
de lo
growth
que es las instituciones que
is
respaldan el
accompanied
tratamiento de cáncer
by
infantil
different
en muchas de las
institutions
instituciones hospitalarias,
and
que
several
son más de
hospitals.
50 fundaciones en más de
Over
35
50
países.
foundations
Esto
in more than 35 countries,
se articula a través de programas
which is
regionales y
articulated
programas
through
transversales
regional
que
and
abarcan
cross-sectional
desde
programs
cuidados críticos,
ranging from critical care
así como también apoyo en el diagnóstico
to
histopatológico y de
support
laboratorio,
in
hasta los
blood-related
sistemas de
and
salud y así como las
pathological
métricas
support,
de desempeño
laboratory
con el programa
support
Profile
and
y
performance
cuidados
metrics
paliativos. Además,
through programs
mediante
in
St. Jude
palliative care.
Academy se impulsa la
The
formación
St.
continua
Jude
y desarrollo de
Academy
líderes a través
bolsters
de la educación
ongoing
profesional global,
training and
así
global
como también
professional
el
education,
acceso al máster
in
en salud
addition to
infantil,
a master's
que es el
degree
programa de
in
Global
child
Scholars,
health,
que muchos de ustedes se han
the
graduado
Global
de ahí. En
Scholars
conjunto,
Program.
esto nos
We have
permite
many
afirmar con
graduates
claridad que
in this
somos una
call.
comunidad global
This is why
trabajando
we
de
can
manera
say that this
coordinada
is a
para
global
mejorar la
community working in
supervivencia del
coordinated
cáncer infantil en
manner
toda la
to
región,
guarantee
que va de
survival
la mano colaborando
of
con OPS. La
patients
que
with
sigue.
cancer in
Esto,
collaboration with
ustedes pueden ver que
PAHO.
hay muchos
As you
proyectos
can
que
see,
van a permitir empoderar para transformar
many
liderazgos
projects build
locales
empowerment to
al frente de la equidad.
transform
Uno de los
global and
principales
local
desafíos para avanzar
leaderships.
en equidad
One
en
of the
cáncer
main
infantil no es
challenges to
solo
move
la parte técnica,
with
sino también
equality
la
are not
parte de
only the
liderazgo.
technical related
Y
aspects,
de
but
esta
leadership
manera,
as well.
St. Jude Global
St.
tiene
Jude
un plan estratégico que
Global
tiene
has a
cuatro
strategic
pilares
plan
estratégicos
with
que
4
va desde la
strategic
creación de
pillars,
capacidad,
ranging from
la
capacity
investigación,
building,
la educación y la
research,
abogacía y recaudación.
education,
Cuando el
advocacy,
liderazgo
and
clínico,
fundraising.
técnico y político
When
no están
clinical,
alineados, los
technical,
avances
and
tienden a ser
political
frágiles
leadership
y
is in
poco
misalignment,
sostenibles.
progress is
Además, las
fragile
decisiones sobre
and
políticas y
unsustainable.
recursos con frecuencia
Decisions
no
on
incorporan de
policies and
manera
resources
explícita
do not
la
necessarily
perspectiva de equidad.
explicitly
Por lo
incorporate the
tanto, desde la
gender
alianza de St.
and
Jude
the
Global,
equality
se ha
perspective. This
respondido
is
a estos
why St.
desafíos
Jude has
fortaleciendo el
addressed
liderazgo
these
local y
challenges by
partiendo de
strengthening
realidades
local
hospitalarias y
leadership,
nacionales. Un
addressing
ejemplo
national and
concreto,
hospital related
¿verdad?
needs. A specific
Es
example of this,
la que sigue.
next please.
Un ejemplo concreto de
A
ello.
specific example of this
Creo
situation
que hay
is
otra
depicted
que va
here.
antes de esta. Un ejemplo concreto de ello es pues apoyando desafíos como
Is
la parte
supporting
de
fighting
la parte de la
challenges
falta de conocimiento
such as
que
the lack
impacta
of
en el
knowledge,
abandono de las familias
which
al tratamiento. Y de
impacts
esta manera
families
se ha
and they
apoyado
end up
junto con OPS
dropping the treatment. This is
programa,
why
proyectos
with
como la maleta de Emily,
PAHO we
que es un
have
proyecto que promueve
projects
la
such
adherencia
as
al tratamiento y la
Emily's
posiciona
bag
el
that promotes
voluntariado
compliance
como
with
un aliado
treatment
estratégico,
and
capacitado
considers
y
volunteers
organizado.
as
Los
strategic
resultados son
partners.
claros cuando empoderamos a los actores
Results are clear when
locales
we empower
para liderar, vamos a
local
generar
stakeholders
transformaciones
for
duraderas y
leadership. We
más
create
equitativas.
long-lasting
La
and
equidad no
more
se
equitable
impone, sino que
solutions.
se construye desde el
Equality is not
territorio
imposed,
con el
yet
liderazgo
it is
local
built in the
frente
territory through local leadership.
a esta misión. La que sigue. De esta manera
Next.
también se han creado paquetes como apoyando lo que
Bundles
es el
have been
diagnóstico
creating
rápido
to
o
support
rapid
rapid
diagnosis,
tests
liderado
or
por
rapid
nuestra querida
diagnosis,
colega
led by our dear colleague
y Share del RAC Latam,
You shared
doctora Paola
direct
Friedrich,
LATAM,
que pensando
Dr.
en los
Paola
factores
Frederick,
que más determinan,
thinking about
determinantes para
the
mejorar la
most
supervivencia en cáncer
determining factors
infantil,
to improve
incluye
survival
el
in
reducir los
child
retrasos
cancer
diagnósticos.
are
Y el paquete de Rapid Diagnosis
reductions
aborda este
in
desafío de manera integral,
diagnostic.
enfocándose en la
Rapid
reducción de los retrasos
diagnosis
asociados al abordaje
focuses
clínico,
on delays
al
in
paciente
clinical
y a las propias
treatments
instituciones de salud.
within
Su
the
objetivo central es
patient
muy claro, el
framework.
cual es
The main
aumentar el
objective is
porcentaje de
clear,
niños
which
que
is to
reciben un
increase the
diagnóstico
percentage of children
oportuno y
that will
preciso,
get a timely and
que
accurate
es una condición
diagnosis,
indispensable para
which
iniciar un
is a
tratamiento
mandatory
adecuado a
condition
tiempo.
to start
El
with
Rapid
a timely
Diagnosis
treatment.
armoniza guías
Rapid
y prioridades
diagnosis
globales con
harmonizes
necesidades
guidelines and
locales,
global
utilizando
priorities with
recursos
local
existentes
needs
y una
using
medición basada
existing
en segmentos de
resources
la trayectoria
and
diagnóstica y estableciendo un indicador
diagnostic
estandarizado de
trajectory
precisión
indicators
diagnóstica. Esto
with
permite a los países no solo
accuracy and
identificar
precision,
dónde
which
ocurren
allows
los
countries not
retrasos,
only to
sino
identify
también tomar
where
decisiones informadas para
bottlenecks
mejorar
occur,
los procesos
but
diagnósticos,
enables them to make
alineados
informed decisions in
con el paquete
alignment
técnico de CureAll y el
with
pilar
the CureAll technical
de centros de
packet
excelencia,
and
lo
the
cual va a tener un
excellence
impacto
centers
real en la
pillar
atención del
with
niño. La
an
que
actual
sigue,
impact on
también alineándose con el
children's
paquete
health.
técnico de
In
CureAll como la
alignment
parte de
with the
accesos a
CureAll
tratamientos y
technical
terapia de
bundle
soporte,
and access to
sabiendo que
treatment
las
as well as
infecciones
support
siguen
therapy,
siendo
knowing
una
that
de las principales
infections
causas de
remain
mortalidad
to be one of the
prevenible en
main
niños con cáncer, se
causes of
lanzó
preventable
lo que
deaths
es la
in
guía
children with
práctica de
cancer.
la hora dorada,
Therefore,
como
the
un
Golden Hour
proceso
Practical
que
Guide was
permite
launched
brindar una
as a
ruta clara
process
basada en
that
evidencia
provides
para
a
garantizar
clear
que
evidence-based
todas
path
aquellas
to
instituciones
guarantee that
especializadas en
all
cáncer infantil puedan
specialized
ofrecer que
institutions
todo
in
niño con
children
sospecha de
cancer,
infección
if there's
reciba
a
antibióticos
suspicion
adecuados
of
dentro de los
infection,
primeros
children will
60
get the
minutos.
right
Sabemos que hay
antibiotics within
estudios
the
que han
first 60
demostrado que
minutes.
por cada
We know
hora que
that
nos
there are
atrasamos
studies
en
that have
cumplir
proven that
el antibiótico en un
the
niño con
as
neutropenia y fiebre,
if there's a
aumenta
child with
el
neutropenia and
porcentaje
fever
de
and
la
we delay
probabilidad de
treatment for
fallecer
an hour, the
debido a esta
likelihood of death
complicación.
will
Más que
increase
una
due
guía
to this
clínica, la hora
complication.
dorada es
More
una
than a
estrategia de
clinical guide, the
implementación,
Golden Hour is an
aborda
implementation
procesos,
strategy which
equipos,
encompasses
flujos y
processes,
toma de decisiones
teams, flows,
adaptándose a
and
distintos
decision making
contextos hospitalarios.
in
Su
adapting to
enfoque es
different
sistémico,
hospital
no solo
contexts
es
with
médicos,
a
y está
systemic
orientado a
based
generar
approach, which
mejoras
is not
medibles y
only medical,
sostenibles en la
to
calidad de la atención, reduciendo
provide
infecciones graves y
sustainable
mortalidad
improvements,
asociada.
reducing
De esta
severe
manera, la
infections
hora
and the
dorada traduce
associated
la evidencia
mortality.
en acciones
The Golden
concretas
Hour
y, como les
translates
decía,
evidence
se
in
alinea con
concrete
el
measures
pilar de
in
régimen de
alignment
tratamiento que
with the
incluye el
treatment
acceso a
regime pillar,
terapia de
which
soporte del
includes
paquete técnico de CureAll
treatment
y
to the
demuestra que
CureAll
con pequeños
technical
cambios bien
package
organizados
access.
se puede
So
salvar
with
vidas.
properly
La que sigue.
organized changes, lives can be saved.
También como parte del trabajo que se hace a
As
nivel
part of
regional,
the regional efforts
que se origina desde el Comité Asesor Regional
and the
de
work of
Latinoamérica,
the Latin
donde
American
este
Regional
proyecto es liderado por nuestra
Advisory
querida colega
Committee.
doctora Julia
This
Palma.
project is led by our dear colleague,
Se
Dr. Julia
establece lo
Palma.
que es un grupo de trabajo,
There is a
¿verdad?,
working group
enfocado en biología molecular, que
focused
nace con el
on
objetivo
molecular
claro de
biology, and it
informar
was
políticas
created with the
públicas,
clear
guiar el
purpose of
desarrollo de
informing public
capacidades y
policy, guiding the
fortalecer la
development of
colaboración
capacity,
regional
and to
para hacer la
strengthen
medicina
regional
genómica más
capacity
accesible
so
y
genomic
efectiva para
medicine
todas las
becomes
niñas
more
con cáncer
accessible
en
and
América
effective
Latina.
for
Este esfuerzo se
children
ha
with cancer
estructurado de manera progresiva,
throughout Latin America.
iniciando
It
en
is a progressive
2024 con
effort
una
that
discusión
started in
estratégica
2024 with a
en una de las
strategic
reuniones
discussion
presenciales
in
del
one of
Comité
the
Asesor Regional de
in-person
Latinoamérica
meetings of the Latin
y avanzó en
American
el 2025 con la
Advisory
creación
Council,
formal del
and in
grupo
2025,
que lidera
the
esta iniciativa y su
leading group was
expansión
formally
regional, y
created
hoy se
with
encamina
regional
hacia la
expansion.
validación por expertos
Today it is
internacionales,
moving to
así como a la
international experts
consolidación de un modelo
validation as well
regional.
as
El
to the
trabajo se organiza en
consolidation of a
subgrupos
regional model.
técnicos
It
enfocados en análisis
works in
situacional,
terms of
desarrollo de cursos
technical
virtuales, una guía
subgroups for
regional y
online
materiales
courses, a
educativos sobre
regional guideline,
comunicación. Los
educational
próximos
materials, and
pasos incluyen
documentation.
la publicación
Next
de
steps
un position
include
statement y
publication
el
of a
lanzamiento de
position
recursos y una
statement,
replicación regional
allocation
y
of
global.
resources,
En
and global and
conjunto, el
regional
proyecto
application.
liderado por el Grupo de
Altogether,
Biología Molecular
the
representa un
project
paso
led by the
concreto
molecular
hacia una
biology
oncología de
group
precisión
is a
más
clear
equitativa,
step towards a more
sostenible e
equitable,
impulsada desde
affordable,
la región.
sustainable
La que
service
sigue.
bolstered from the
Y
region.
finalmente,
And finally,
apoyando siempre St. Jude como colaborador de la iniciativa
In
global
order to
para
support
el
St.
cáncer
Jude
infantil,
as
se
the
lanza lo
global
que es
coordinator of the
el
effort,
GICC
we
Accelerator, que es
launched
el acelerador
the
de la iniciativa
GICC
global del
Accelerated,
cáncer infantil.
the
El primera convocatoria fue en el
Global Accelerator.
2025
The first
y
open call
ahora
was
se
held in
se
2025,
lanzó en diciembre del año
and
pasado
in
la
December
convocatoria
last
para
year,
el
the open
2026
call
y
for
2028.
2025 and
¿Qué es el
2028 was launched as
acelerador de
well.
la iniciativa global?
What is
Pues
the
es
Global
para este
Initiative
periodo,
Accelerator?
es un mecanismo
For
que se ha
this
diseñado
period,
para
this
apoyar la
mechanism
implementación
was
de prioridades
designed to
nacionales
support
y regionales
implementation
en
of
cáncer
national and
infantil.
regional
Su
priorities in
enfoque
children
está
cancer.
plenamente alineado con
The
el paquete
approach
técnico
is
CureAll,
in full
integrando
alignment
sus
with the
pilares,
CureAll technical
así como
bundle.
sus
It
facilitadores
integrates the
y los
pillars,
proyectos
the facilitators,
centrales de CureAll
and the
para
CureAll
asegurar
main
coherencia
projects to
estratégica y un
guarantee
impacto real
strategic
en los sistemas de
coherence and
salud.
an actual
El
impact
proceso
on
de
healthcare
aplicación es
systems.
claro y se
The
desarrolla en dos
enforcement
pasos.
process is clear
El
and it
primer
is
paso
developed
es
in a
la presentación
two-step approach. The
de un
first step
resumen de una página
involves
o one
submittal of
pager
a one
que
pager,
permite consolidar la idea,
which allows
verificar la
to
alineación
consolidate the
estratégica, la
idea, verify
alineación
strategic
con
alignment,
las necesidades de la
alignment
región
with
y priorizar
regional needs
iniciativas
as
con un
well,
alto
as well as
potencial de impacto.
prioritizing
Y
initiatives
una
with
segunda
high impact
fase,
potential.
la cual
Phase two
consiste en trabajar
is
ya
made
una
up
propuesta
of
que ha
developing a
sido
proposal,
seleccionada y esta presentación de esta propuesta
and
ya más
the
completa es a través
full
del portal de la
proposal
Organización Mundial de
submittal
la
is
Salud,
done through
quienes
the
presentan son
WHO website.
la oficina regional de OPS en
The
Washington y
regional
las
PAHO
oficinas
office in
de OPS en
Washington, as
cada
well as
país,
the PAHO
así como los
offices throughout
ministerios
the
de salud,
nations, as
y
well as
este
the
está previsto
health
para
ministries.
presentarse en marzo del 2026.
Submittal
Lo que se
will be
busca
done
con
in
este
March
modelo es poder
2026.
acelerar
The purpose of this
soluciones
model is to
factibles,
accelerate
sostenibles
new
y alineadas
feasible,
con las
sustainable
necesidades de los
solutions in
países,
alignment with country needs,
transformando prioridades y acciones
transforming
concretas.
priorities
Hay
and concrete
ciertos
actions.
proyectos o propuestas que
There are
van a estar
certain
alineadas con
projects or
país, pero que al
proposals
mismo
in
tiempo
alignment
se
throughout the
alinean con la
country, but
región,
at the same
y
time in full
otros
alignment
tienen
with the region,
una
and
alineamiento transversal
others involve
con las diferentes
cross-sectional
regiones
alignment with the
de
regions
OMS que
that
pueden
make up the WHO,
presentarse como propuestas globales.
and they can be
Así que
submitted
con
as
todas
global
estas
proposals.
herramientas y con esta
With all the
colaboración como
tools
St. Jude,
and with
pues nos
this
ayuda a ir
collaboration with
avanzando en
St.
ofrecer
Jude's,
a
we
nuestros
can
pacientes
provide our
un
patients
acceso equitativo a
with equitable
condiciones
access
de tratamiento con un entorno que permita que el paciente se sienta digno
in
y
an
que
environment
pueda
that provides
acceder a
dignity to the patients
a un cuidado más
so they can all
equitativo y de
access
calidad.
more
Muchas
equitable
gracias.
and quality services. Thank you.
Excelente, muchísimas gracias, Suad y
Excellent.
Liliana, por
Thank you,
presentar
Swad. Thank
estas
you,
nuevas
Liliana, for
herramientas. Realmente son recursos
showcasing the new tools.
invaluables, ¿no? Para mejorar
These are
el cuidado
invaluable
para los niños
resources
con cáncer y para
to
aumentar la
make
sobrevivencia,
treatments
¿no?
better
And
and to
I note
improve
some of the comments in the
survival
chat
rates.
regarding the English translation, which can be found in the icon at the bottom of the screen. Apologies if the sound is not coming through, or if the quality is not optimal. We will do our best to make sure that our webinar is bilingual and available for all of our English speakers as well as Spanish speakers in the region of the Americas. We really, really want to get these resources out there and used, because we know that through early diagnosis, rapid detection, preventing infections, following standardized treatment protocols, improving access to medicines, these are all the inputs that we need, not only clinical care, but system changes to improve health systems, to ultimately improve childhood cancer care in the region. And we're so excited to launch these new resources. And you'll also see in the chat the link to the PAHO webpage for the CureAll America's resources. They're available again in English as well as in Spanish. Solo hay que buscar en el sitio de la OPS CureAll Americas recursos.
You
Y
just
se
have
puede
to go
acceder
to
todos
the
esos recursos
OPS website to get a hold of the resources that we're promoting throughout this webinar. Let us move on with the agenda. And the first block, we will address the group of medications so you can also understand how treatments are being currently improved. For the first block, we have Dr. Liliana Vasquez, Technical Officer for Child Cancer at PAHO, and Dr. Manuel Lavayan from the Strategic Fund at PAHO as well. Thank you, Silvana. This is a key block on medications. And in a few minutes, we'll give the floor to our Ecuadorian colleagues, as well as the colleagues from El Salvador, that will share information about the global platform to access drugs for child cancer. Thank you to our colleagues. Thank you to the colleagues at all the institutions. Project implementation started more actively in February this year when Ecuador started to receive the drugs from the platform. Over 300 children had benefited already, not only with the quality, but with the opportunity to being able to treat the patients. We are proud that access to medication in the countries is now a reality. Major progress has been made also in strengthening the healthcare systems in both countries. Improvements in planning systems, in cold chain and supply distribution to strengthen the healthcare systems and to make the whole system better. Mr. Manuel Lavayan from the Strategic Fund will share the impact. And I would also like to let you know that if you want to have access to further information, we have a bilingual website in English and Spanish, and we have for educational modules, we have an online course with over 1,400 trained professionals throughout the countries that have been fully educated. Manuel, the floor is yours. Thank you, Liliana. Now that we're celebrating the Childhood Cancer International Day, we need to focus not only on numbers, but the fact that lives have been saved and that we have invested over $3.3 million in strengthening the systems, creating a global platform to guarantee sustainable conditions for essential medications. And as you can see, over 70 drugs and formulations have been distributed throughout 18 drug categories throughout our acquisitions department that is working with 19 vendors who guarantee the highest standard of care and ongoing supply. We have currently delivered over 57,000 units, and we have strengthened the continuity of treatment throughout participating countries. In addition to that, the project provides added value to other member states. 9 member states have benefited from the negotiated prices, allowing for public resource optimization and broader coverage in the rest of the countries as well. In 2026, we will expand coverage. We have already included El Salvador, reaching 10 clinics that are already part of the platform, which translates into an evidence-based collaboration. It is an expansion with a purpose that has led us to tangible global expansion throughout the
Gracias,
and
Manuel.
specifically throughout the region.
Vamos a empezar con
Thank you,
nuestra
Manuel.
colega de Ecuador.
Now I will give the
Adelante,
floor
doctora
to
Elizabeth
our
Warren,
colleague
punto
from
focal
Ecuador,
nacional de cáncer
the
infantil del
focus
Ministerio de Salud Pública.
focal point at the healthcare ministry.
Un placer poder compartir hoy con ustedes. Permíteme ver si puedo.
I'm so happy to be here with you. Let me just
Entonces, solamente
see
para ir de manera breve,
something.
lo que
Let
ha
me just go
sido el
briefly what we've
camino de
done
Ecuador
and what
a lo
is the
largo
path of
de
Ecuador
todo lo que significa la Plataforma Global de Acceso a
by
Medicamentos contra el
using
Cáncer, que es un
this
cáncer para nosotros. Estamos
GPA
hablando
CCM.
de
We're talking
un proyecto
about
que empezó en
a
abril
journey
del
that
2023
started
cuando Ecuador
in
fue finalmente
April
seleccionado
of
para
2023
pertenecer a
when
esta primera
Ecuador was
cohorte
selected to be part
como
of
plan
this
piloto,
cohort
¿no?
as a
Eso
pilot
motivó
program. This
que
motivated
se
or this
realice un
caused that
diagnóstico
we created
situacional
a
sobre dónde
situational
estábamos
diagnosis
parados.
where
Y
we
no fue
were.
fácil
And it was
poder
not easy
decir,
in terms of
no
knowing, oh, you know
tenemos
what, we don't
suficientes
have
datos,
enough
no
data
tenemos
or
tantos
we don't
centros
have
especiales que atienden a los niños, niñas y
supplies
adolescentes.
for
Entonces, eso nos
hospitals that
motivado
take care of
en ese
children and
momento a decir, bueno,
adolescents. So
¿con
back
quiénes
then,
vamos a trabajar?
we said, okay,
Lo
who
cierto
are we
es
going to
que
work
hemos
with? So what I
empezado a
want to
articular
say is that we have
y
started to
poder indicar al
articulate all
resto de
this and to be
sectores
able to
no
invite
fue tarea
the rest of the
fácil
sectors
y no
was
es
not
tarea
easy.
fácil
And it is
cuando
not an
tenemos
easy task when we
una
have, for
dinámica
example, a
en Sudamérica
dynamic
que nos
in South
lleva
America that,
a ser
sometimes
fraccionados o a
we
tener
are
estos cambios de
divided. Let's just
autoridades
say
donde
that we
nuestros
have
comprometen a
sometimes
veces
changes of
grandes
authority
estrategias.
and sometimes
Entonces
this
hemos logrado
compromises the strategy.
consolidar
So
y
we've
mantener
managed to
durante bastante
consolidate and to
tiempo un
keep
equipo gestor
for a long time
desde el
a
nivel central ha
management
ido
team that from the
invitando y
central part
manteniendo
they have helped us to
actores
be
como
able to keep
Solca, como ARTSA,
actors at
como la
Solca,
seguridad social, como
ARSA,
la policía,
Social
como la
Security, the
academia, como cuidados
police, the
paliativos.
academy.
Entre nuestros logros,
And
en el
as part of our
2024, la
achievements
conformación de la
back in
Comisión Nacional de
2024,
Cáncer en Niños y
we
Adolescentes,
were
que ha
able to
autorizado unos
form the National
medicamentos
Commission on Cancer in
nuevos
Children and
que estaban
Adolescents.
completamente por
They
fuera del
authorized
Programa
new
Nacional
medications that they were
Prioritarios de
outside
Cánceres.
the framework that we
En el
used.
primer semestre
During
de
the first
enero
semester
a
of
junio del
January to
2025
May of
empezaron a arribar
2025, we
medicamentos ya
start
donados por
receiving
la estrategia
medications
y se empezó
donated by the
a preparar
strategy,
los
and we
recursos de
started to
recomendaciones
prepare
básicos para
the
el manejo de
basic
quimioterápicas
recommendations
en
for
las instituciones que ya
chemotherapy
habían sido
management.
seleccionadas y
And
que estaban divididas en dos
they were
fases. En el
divided, some
Ministerio
of
de
the
Salud
groups
Pública, que
in
suman
the
5
Ministry of
contra los
Health,
otros
that they are
4
5, against the others,
que
that they were
conforman la
4,
red privada
and
y
they
que
are part of
también
the
atienden
public
niños, niñas y
private
adolescentes con
network that they
cáncer,
also take care of children
articuladamente
and
con el
adolescents.
ente rector,
And they also work with the
tener
authorities. So
bodegas
the
o
idea of
plazas
having, for
para
example,
poder
warehouses
almacenar
or
adecuadamente
spaces in
estos
order to be able
medicamentos y
to
finalmente
store
poder
these
tratar
drugs
todos de
and
la
also to
manera
be able to
más estandarizada las
work
6
in the most
patologías
standardized
priorizadas
manner with the
a
6
través del Fondo
pathologies that we have
Estratégico de St. Jude,
prioritized. So
de la
through
visión y el
the
apoyo de
strategic
OPS
fund of
Nacional,
St.
de
Jude's and also with
OMS,
the
y
support
el
of PAHO
fortalecimiento de estos
and the
5 hospitales
strengthening of all these
emblemásticos
5
multipletos en
hospitals
cadena de
and with
frío
the
y la
new
donación de
equipment of
camas
cold
como
chain
laminar fue
and
invaluable
also
para finalmente
other
poder
areas that they
brindar
help us
otro
with.
tipo
This was
de
paramount in order to be
contención
able to
a la
provide a
atención
different
de
type of
estos chicos con cáncer.
service to the
Entonces,
patients.
ahora cuando miramos hacia atrás,
So now when we
tenemos
look
inevitablemente que
backwards, we
pensar
have
cuáles
to
son los retos
think,
a los que
what
nos
are the
enfrentamos.
challenges that
Y
we are
recuerdo,
facing right
y
now?
Liliana
And I
probablemente
remember, and maybe Liliana will not let me lie about this, but
va a recordar esto
she will remember this too.
estas diapositivas
When
eran
we use
más
this
puntos rojos que verdes y amarillos. Entonces,
speakers,
sí es
well,
necesario
when we
que
use
dentro de
this
los
slide
3 pilares que
back
en
in the day,
Ecuador
most of
encontramos
these blocks
para
were in red.
fortalecer la atención de
And this is something
esta
that we
población tan
identified. What
importante,
were the challenges that
se
we
sepa
needed
que
to support?
teníamos
So
lo de
we
gobernanza, lo de
had
gestión
governance,
clínica y lo de la gestión
clinical
del pago como
management, and
suministro.
also
Y dentro
the
de la
supply
gobernanza,
chain.
uno de
And
los
as
logros más
part of
grandes que
the
hemos tenido últimamente
governance,
es
one of
la
the
ley
main
orgánica para la
achievements is
atención
that we
integral del
have an
cáncer con un
organic
capítulo
law
realmente
for the
fuerte para
integral
niños, niñas y
attention of
adolescentes.
cancer, and
Esta
mainly
ley se está
for
articulando con
children.
la
And
ley
this network
orgánica
is
de cuidados
getting
paliativos y aunque no está
linked to the
fundamentada
palliative
también la
care. And
ley
even though that is not already linked to that,
salud
but we also
mental.
have
Para
mental
estas 2
health.
leyes que están en verde es porque ya
For the
fueron
first 2 that we
aprobadas por
have
la
in
Asamblea.
green,
Ahora
these
estamos
are
en
already
breve
approved by the Assembly. Now we are in the
programa
process
de
of
elaborar el
getting
reglamento para la
a
ley de cáncer
new
y el reglamento incluye
regulation
elementos
for
ya que se
palliative
estuvieron
care
dando a conocer
and
antes de la
for
elección.
the ruling for cancer care. They have a national commission that they have created, and they have multi-sectors. For example, last year we were able to move forward with the agreements that we have for the phase 2 of Solca hospitals, that they are also going to be benefit from this medications. We also have a proposal that is pretty solid of how we can have a obligatory or a compelling notification to the authorities, because otherwise without numbers we cannot do anything about it. We need to strengthen our regulations. So that's why we need to learn how many patients we have and how many require treatment. The same way we have been able to move forward with all the training in terms of pharmaceutical, the clinical care, and also they, for example, consider how many medications will they need for a specific time. What is the monthly average consumption? And this could be related to a possibility of having lack of, for example, medications. We also have an inventory, national inventory network. And the truth is that we are fully committed, and something that we heard back in 23, childhood cancer will determine the rest of the pathologies as part of the country. This is going to motivate the public policies and the solutions. And that's real because we are better organized with a lot of areas open. But you know what? The strength is in when we are together, when we work as a team, how we perform, and the fact that each responsible actor will do whatever they have to. So together with St. Jude's and the MNCP as the regional authority, and also ARCSA and Solca, by integrating other strategic allies. So this is all on my behalf. Thank you. Thank you, Lisette, for your excellent presentation. And now we have Doctora Andrea Chacón Claros. She is head of the technical team from El Salvador from the non-communicable diseases. Good morning, everyone, and it is a pleasure to be here with you. I'm very excited to be able to participate in this event in the International Childhood Cancer Day. Let me just give you a snapshot of what we've been doing in our country for implementing this platform, the GPA-CCM. Okay, so first of all, let me say that we have to understand what is the national context as a country. For us, we have an average of 258 children that they've been diagnosed on a yearly basis. They are below 19. We also have a third level hospitals. And in the National Benjamin Bloom Hospital, this is where we have our strongest part. We have 5 pediatric oncologists, and for us, the percentage or interval that we have to diagnose children, it's 30 days, and a lack of adherence to treatment less than 1%. This is information based on the population of El Salvador. We have a survival rate of more than of 5 years, 53%. This was an analysis that we did after the oncopediatric analysis done from 2014 to 2023. And in order to be able to have a standard in terms of the work that we do, we develop guidelines and the technical packages of CureAll. We've been able to have some progress, and we also have created the national plan in order to provide integral care for cancer in children and adolescents, and this is valid until, it was valid until 2025. We need to work on this again. And we also have the national protocols for treatment of childhood cancer. And also we have the early diagnosis guideline for childhood cancer. And they are all very important in order to be able to provide an ongoing medical training to our health professionals, and also together with the work that we perform, and with the another alliance that we have of called FAVIF, for example. It is very important that I tell you that we are part of the global initiative of CureAll since 2023, and this has helped us to, as I was saying, to execute the tasks and to be able to follow all the guidelines of the CureAll. And now we're part of the platform of oncological medication. We've been able to follow implementation phases that the truth is not, we're not going to execute one and then the other one. These are simultaneous steps that we want to take. Some of them, they've been key. For example, at the beginning, the request in order to be able to be part of this initiative by means of a formal document sent to the World Health Organization and also PAHO to be part of this global initiative. Also, we have drafted a MOU, and this is a legal document that we have in order to establish what will be the execution standard. This was already signed after the review of the coordinations. This was signed back in 2025. Also, we gather a team. I am the head of this group. I'm the focal point. And we also have a multi-sectorial team in order to cover all the areas that we need to bear in mind. That is supply chain, reception of drugs, customs, storage, to dispatch this to all hospitals, and the application of medications. Of course, after having a situational diagnosis in order to see what is the installed capacity that we have and for that we need to perform a process of filling in some documents, and we had some experts from St. Jude's and PAHO, so they help us to analyze the supply chain. And afterwards, after we receive the observations or comments, we improve the parts that they suggested, and that help us to create a work plan. And this include to be able to work on the observations given by the authorities or the PAHO and the St. Jude's, and to see what is analyze the demand, and to have all these protocols, and to see the need of all the medication that we were lacking. And this helped us to be able to prepare a program, and also the baseline information or evaluation. That's something that we did with an external agent, that is the IOD Park. We are now very aligned with the information that we provide, with information that they gather, this external agent. And well, we've been able to have a lot of progress, and we were able to assess all the requirements, the inventory of medication, and we are expecting to receive the first batch for the second quarter of 2026. These are just the notes that we have, the request, the acceptance letter, and the work that is formed by the different organizations, hospitals, also civil society, and also we have the superintendents of sanitary regulation authorities. Everything, this is part of the National Commission of the task force that we created, and we also we pay a visit to the hospitals and the warehouse where we presented our installed capacity. And after the visits, we were able to create an operational plan. This was the last day of the tour, and this is just a view of the different work meetings that we've had between the virtual and in-person visits in order to solve all of the observations that were given from the PAHO and St. Jude's. And we will receive the last observations in this month, and we will have to solve all of those. As a conclusion, as a country, we will have access to 33 medications for our treatment protocols that, as I already mentioned, it's ready. A coverage of about 258 minors or minor less than 19 years old. We want to increase survival rate over 60%. We want to strengthen the quality of the processes in our supply chain and also to standardize all the process that we have. It is very important for the quality of the medication, and this has been a whole journey. We have a guided, monitored, and assessed process that comes from planning, programming medication, up to the application to the patients. And the objective is to be able to guarantee that they are complying with that chemotherapy or treatment to each one of those children that we are treating. So thank you, everyone. Thank you, PAHOs and Jude, for all your help. And well, I believe that we will be able to move forward, and the benefit for all our population of less than 19 years that they will require this oncological treatment. Thank you so much. Thank you, Doctora Andrea and Lisette, for sharing this incredible progress in the platform in order to access medication. Thank you so much. Thank you, Liliana and Manuel, for showing us what we're doing and the initiative that we're following or that we have in order to have access to medication in this global platform for access to childhood cancer medication. Let us continue with our program. And this is regarding the hematopoietic stem cell transplantation in childhood cancer, HSCT. So I pass the floor to Claudia Sampor. Claudia. Thank you so much, Silvana. Thank you, everyone. Thank you for being here with us and to share this important webinar with everyone. Now, let me just start with this part. Let me just say that the Cooperation South-South is a model based on solidarity. We like to learn from everyone and with countries that they're facing the same challenges. In the Andean society, they're also having the same challenges. And the idea is to be able to adapt normative guidelines in order to be able to tackle the reality. We have two projects that are very important. The first one was developed back in 2023, and it was centered in the in early diagnosis and timely diagnosis in the Andean communities. We work together with the work of different projects, like, for example, face-to-face workshops, virtual courses, campaigns, publications, and all these actions. Even now, they are still a very important impact because they help us to strengthen all the national capacities and saying that the cooperation between countries may be able to accelerate changes, concrete changes in the health system. Now, this cooperation model was based on a second project that started back in 2024, and it was focused on this hematopoietic stem cell transplantation. Now, both projects contributed to consolidate this Andean roadmap for 2024 and 2030, and proving that all the countries are working together, they're sharing knowledge, they're building joint solutions in order to be able to have a great level of survival in children and adolescents with cancer. Let me just say that the development and implementation of these two projects was possible thanks to the strategic alliance of many key stakeholders, including, for example, the Andean Health Organization, the Ministry of Health of the both Andean countries, also the centers of professionals, health professionals, and these projects were led by the PAHO with the support of St. Jude's. Now I have the great pleasure of presenting the speakers. We are going to hear Luis Bengolia, who is the coordinator of the Andean Center. And Luis, you have the floor now. Thank you so much for being here with us this morning.
Muy buenos días, muy buenas tardes.
Hello, everyone.
Deseo brindar un cordial
I
saludo
want
de
to give
parte
you
del
a
doctor Raúl Datelli, secretario ejecutivo de la
congratulations
Andino
and
de
to
Salud,
say
y
hello from
agradecer
the
la
head of this and to thank PAHO
y la persona del doctor
and also
Jiménez,
Dr.
la doctora
Altergenis and
Silvana
also
Luciani,
Silvana
y por supuesto
Luciani
la doctora
and
Liliana
also
Vázquez,
Liliana Vasquez for her
a
support.
los funcionarios también de St. Jude's Christian Children Research Hospital por esta invitación.
Thank you
Voy a
for
presentar de
this
manera directa
invitation.
dónde estamos y qué
I'll
necesitamos
share with you the
para
current
garantizar el
status
acceso
and what we need
equitativo
to
al
guarantee
trasplante de
equitable
progenitores
access to
hematopoyéticos en la subregión andina.
transplants
Permítame
of
comenzar
hematopoietic
contextualizando por qué
progenitors in
este
the
tema
Andean region.
es prioritario
First, let
en
me
el área
explain why
andina,
this
el
is a
espacio
priority in the
donde
Andean
participan los
region.
países
This
como
is a space
Bolivia,
where
Chile, Colombia,
countries such as Bolivia,
Ecuador, Perú
Chile,
y
Colombia,
Venezuela.
Ecuador, Peru, and
Siguiente slide, por favor.
Venezuela work
El
interconnected.
cáncer infantil es una de las principales causas de muerte por enfermedades
Child
no
cancer is one of the
transmisibles en
main
jóvenes
causes
de
of
la
death
región de 0 a
due
18
to
años. Aunque la
non-transmissible diseases
incidencia es
amongst children
similar
and
en
youth
todo
in
el
the region.
continente, la
Although evidence
supervivencia
is
no lo
similar
es.
throughout
Los
the region,
pacientes de
survival isn't.
ingresos los pacientes de países de ingresos altos superan
Patients
el
from
80% de la supervivencia. Y
high-income
en los
countries
países de
exceed
ingresos medios y
80% of
bajos,
survival.
apenas
In
llegamos al
low-income and middle-income countries,
55%
we
en
barely make it
promedio
to
en nuestra región.
55% as an
Aquí
average in the
comienza
region.
la inequidad.
This is
Y cuando
where
miramos
inequality
solo a la
starts.
subregión
If
andina,
we focus
la
only
situación es aún
on
más
the
preocupante.
Andean
La
subregion, the
mortalidad
situation
es
is
de
increasingly
5.3 por
worrying.
100.000, muy
Mortality
por
is
encima del promedio
5.3
regional,
per
que es de
every
4 por 100.000.
100,000, which is
Esto se debe a diagnósticos
above
tardíos,
what
falta
happens
de
in the region of
especialistas y
4
desigualdades en el acceso a
in
medicamentos
every
esenciales, entre otros.
100,000
Es
due
decir,
to lack of
no es
access
un
to
problema
essential
biológico,
medication, among
es un
others. So
problema
this is
del
not a
sistema.
biological issue.
La
It is a
iniciativa
systemic
CureAll
problem.
plantea una
The CureAll
meta
initiative
global del
has established a
60% de
global
supervivencia
goal,
mediante
60%
detección precoz
survival
y
rate
acceso a
through
tratamiento
early
oportuno,
detection
como
and
llaman sus
access
braquianos.
to
Para la
timely
subregión
treatment,
andina,
as mentioned before.
alcanzar esta
For the
meta
Andean
requiere cerrar
subregion
brechas
to
de
attain this
tipo
goal
estructural
means
y una de las
narrowing
más
down
importantes
structural
es el
gaps.
acceso
One
a
of the
TPH.
main
Siguiente
gaps
lámina, por favor.
is access to
Y ahora
HSCT.
concentrémonos en uno
Now,
de los problemas
let us focus
más serios
on
dentro
one
de
of the
los
most
pacientes que
serious
tienen cáncer
issues
infantil. La
inflicted
leucemia
on patients
representa el
with child cancer.
36.6%
Leukemia accounts for
de los casos de cáncer infantil,
36.6%
pero
of all
causa el
child cancer cases.
45.3% de
It
todas las
causes
muertes. Es decir, su peso
45.3%
en
of all deaths,
mortalidad es
which means that
desproporcionado.
the weight in terms of
Y en los
mortality
casos
is
de alto riesgo,
disproportionate.
la
In
recaída o
high-risk
refractariedad,
cases,
el TPH es la
the
única opción curativa.
refractory
Por
rate
eso es tan crítico
of
fortalecerlo.
HSCT is
El
critical and it
TPH,
needs to
la
be
siguiente lámina, por
strengthened.
favor. El TPH es una intervención
HSCT
esencial de alta
is an
complejidad.
essential high
Es
complex
fundamental para
intervention,
leucemias, tratamiento de
and it is
leucemia y
key
enfermedades
to treat leukemia and to
hematológicas graves.
treat
Su
severe
disponibilidad define la
blood
capacidad
pathologies.
estratégica del sistema de salud.
The
Y es un
healthcare
eje
system
de
needs to
equidad
reinforce its
regional.
strategies
Donde
because
hay
this
TPH,
is key for the region.
Donde no
If
la
there's
hay,
a
la
chest
brecha se
CT, there's
profundiza.
survival. If there isn't,
Siguiente lámina.
the gap just
Cuando
gets deeper
analizamos
and
la
deeper.
capacidad real de
If we
TPH en la
analyze
subregión, este es
the
un estudio que
actual
se hizo
capacity of
el
HSCT
año
throughout the
pasado,
region, and this is
la
according to a study
inequidad
performed last
se
year,
vuelve evidente.
inequality
Tenemos los dos polos
is
opuestos. Bolivia
underscored.
tiene
There are
1.6%
two extremes.
del cumplimiento de
Bolivia
su meta en atención
has
de
met
trasplantes y
its
Chile llega
transplantation
al
goal
100%.
up to
En este
2.6%,
interior de
whereas Chile reached its goal at
vemos que Perú
100%.
tiene el
In the middle,
29%,
you can
Ecuador
see that
24 a
Peru is
40%,
at 29%,
Venezuela
Ecuador is at
42.5%,
24%,
Colombia
Venezuela is at
80% del
42%,
cumplimiento de su meta.
Colombia has met the
Esta es
goal
una brecha
at
estructural que se
40,
traduce
at
directamente
80% level. So
Siguiente lámina, por favor.
this is the
Pero
current situation of
es
the
importante
region meeting
también
the goal.
subrayar lo que se ha avanzado.
It
Y ya lo ha mencionado
It is
la
important to highlight the
doctora
progress
Lisset
that has been
en el
made. And
espacio
as
andino.
Dr. Lisette already mentioned,
Es
let
importante
me focus a
reconocer
little bit deeper
lo que hemos
in what's
avanzado
going on
y
in
en
the
solo
Andes,
4 años
because
la
major
región ha
progress
logrado
has been
disponer
made throughout the last 4
política
years,
andina de cáncer,
because we have
plan
the
andino de
Andean
prevención y
cancer
control del cáncer
policy, the Andean
2024 al año
plan to
2030.
prevent and control
La hoja
cancer
de
from
ruta para
2024
cáncer
to
infantil que
2030.
se
The
construyó en el año
roadmap for child
2023
cancer
y es para
consolidated in
cáncer infantil nuestra
2023
guía.
for child
La
cancer.
guía andina
These
de
are our
TPH
guidelines. The
se ha
Andean HSCT
aprobado el año
guidelines,
pasado.
which were
El
approved last year,
diagnósticos situacionales de cáncer y cáncer infantil
cancer
y se
and
han llevado
child
a cabo
cancer
reuniones
situational
técnicas en Santiago,
diagnosis,
en
as well
Bogotá
as
y en el
technical
Valle
meetings
Sagrado
held
de
in
los Incas en
Santiago,
Cusco, Perú,
in Bogota,
para
and in
ajustar
the
los
Sacred Valley of
avances
the Incas
y
in Cusco,
desarrollar nuevas
Peru,
estrategias
to
o modificar
discuss
las que ya
progress,
estaban
to
avanzando.
envision new
Esto es un
strategies, or to
proceso
amend the
político
already
y
existing
técnico,
strategies. This is both a
considero, sin precedentes.
political and
Siguiente
technical
página o
effort that
siguiente
I
lámina.
believe is unprecedented.
La región ya tiene una propuesta clara para
The
cerrar
region
estas brechas.
already made a clear
La hoja de
proposal
ruta
to narrow
plantea
down
tres ejes:
the gaps. There are
gobernanza
3
e
axes in the
infraestructura,
roadmap:
gestión y
governance
capacitación
and specialized
y acceso
infrastructure,
e
management
implementación
and training,
inmediata.
as well as access to
Siguiente
immediate
lámina, por favor.
implementation. Next.
El mensaje es claro y
The
directo.
message is
La
clear
región
and
ya
pretty
cuenta con el
straightforward.
diagnóstico,
The region
la hoja de
has
ruta
already a
y el
roadmap,
consenso político.
diagnosis, and political
Todo lo
consensus
esencial
in place.
está sobre la mesa.
Therefore,
Lo
the
que sigue
essentials
es
have
ejecutar.
been laid on the
El
table,
TPH
but the next
no
step
es solo
is
una intervención
execution.
técnica,
HSCT
es
is
una
not only
decisión
a
que define
technical
equidad
intervention,
en
but it
cáncer
is a
infantil.
decision that will
Es la
define
línea
what
que
equality
separa lo
means in
posible
child
de
cancer.
lo
It is the
inaceptable.
line that
Y
will
si avanzamos
separate
juntos, como lo
what's
recuerda la
impossible
presentación,
from what's
eh,
unacceptable.
este comité andino de prevención y
The
control de
Andean
cáncer, el
Prevention
grupo de
and
trabajo
Control
de cáncer
Committee,
infantil
the
de los
working group on
ministerios de
child
salud,
cancer from the
la
health
Organización
ministries,
Panamericana de la Salud con sus
the Pan
asesores
American
regionales
Health
y en
Organization
cada país
throughout
andino,
its legal
los asesores de
advisors
San
throughout
Jude
the Andean
y la
region,
Secretaría
the St.
Ejecutiva
Jude
del Organismo Andino de
advisors,
Salud,
and the
avanzaremos
executive
porque
secretariat
juntos
of the
somos más fuertes
Andean
y
Health
juntos
Council will make
llegamos
progress
más
together because
lejos.
together we
Muchas
are
gracias.
stronger and together we can make it even farther. Thank you
Muchas
very
gracias,
much.
doctor Bengolea,
Thank
por
you,
el repaso
Dr.
de este gran
Bengolea,
proyecto.
for
Y a
providing
continuación,
us
le
with
damos
a
la palabra a
summary
la
of
doctora
such
Julia
a
Palma.
relevant
Ella es
project.
hemato-oncóloga
Next,
pediatra,
Dr.
asesora del
Julia
Gabinete del
Palma,
Ministro de Salud
a
en Cáncer Infantil y
pediatrician
Trasplante del Ministerio de Salud de
advisor
Chile.
to the
Es
Chilean
presidenta de la
Health
Sociedad
Ministry,
Chilena de Hematología y Oncología
chair of
Infanto-Adolescente
the
y consultora regional para el
Chilean
Programa Regional de América Central y
Children's
del Sur.
Oncology
Sus
Center,
países focales son Bolivia,
representative
Ecuador,
of
Perú
South
y
America. Her
Chile, y esto es del
focal
Departamento de
countries are
Medicina
Bolivia,
Pediátrica
Ecuador,
Global de St. Jude.
Chile,
Ella
and
presentará en
she
representación del grupo
works
de
together
trabajo de
with
las
St.
CONA.
Jude.
Adelante, Julia,
She's
por favor.
here to
Muchísimas
share
gracias,
the
doctora
results
Sampor.
of
Quisiera
the
sumarme
task
a los
force.
vocativos
Thank
que
you, Dr.
manifestó el doctor
Sambor.
Bengolea en agradecimiento a esta oportunidad
I
que reconoce el
joined
cordón
Dr.
andino en
Bengolea
poder presentar los avances en trasplantes de
in
progenitores hematopoyéticos en
sharing
nuestra
this
subregión.
presentation
Y
on
antes que nada
hematopoietic
comentar que no puedo estar más de acuerdo con lo que el doctor comentó respecto de
transplants
la brecha,
in
¿no es cierto? Y la
the
inequidad
region.
y donde el trasplante es una herramienta terapéutica más
Transplantation
que se
is
suma
yet
a los
another
tratamientos de
therapeutic
quimioterapia,
tool that
cirugía,
is added
radioterapia e
to
inmunoterapia que
chemosurgery,
habitualmente reciben los
radioimmunotherapy
pacientes
treatments
oncológicos.
that
Y yo
oncological
diría que
patients
el hecho de
are
tener un
currently
consorcio
receiving. So I
andino
would like to
que
say that the fact
aúna
that
los
we have an
esfuerzos desde los
Andean
ministerios de salud
consortium
junto
that
con
brings
los
uh,
representantes de EPS y Orascono de cada
the
uno de los
PAHO, the
ministerios
health
y de los
ministries
países que
throughout the
están
region
en
and
este
different
grupo de
healthcare
trabajo,
related
hace que
institutions
tengamos una
throughout
política
the
pública que es
region
la
renders
REMSA año
a
2022,
public
que es una
policy
hoja de ruta andina contra la cáncer
that's
infantil y se
called
manifiesta que
the
cáncer es
REMSA
una prioridad
resolution
regional,
created in
sobre
22,
todo visualizando
where
la
we note
inequidad en
that
la mortalidad que existe en la
inequality
subregión
in
andina respecto a
mortality
otras regiones
throughout
del continente.
the
Luego
Andean
tenemos esta
sub-region must be
oportunidad de
addressed.
hacer un diagnóstico
And we also
situacional
have
entre
an
el año
opportunity,
2023
we
y
had an opportunity
2024 con
to
un mapeo de
conduct a
red identificando
situational
los centros de
diagnosis
trasplante, que era
in
una gran interrogante
2023
que
and
teníamos.
2024,
¿Cuántos
where we
realmente
mapped the
existen? En
transplantation
el año
centers because we
2025 se
didn't
trabaja en
know
una
how many
política
we had
pública
up to
para
that point.
trasplante,
In
involucrando a
2025,
los
we worked
ministerios
on
de
a
salud
public
de los
policy
países con
for
una resolución
stem
REMSA
cell
también
transplants
para
through
generar un
another REMSA
mandato de
resolution in
prioridad
order
respecto de la
to
necesidad de contar
prioritize
con
the
trasplantes progenitores
information and getting a
hematopoieticos
hold
cuando
of
corresponden los
enough
pacientes
information
pediátricos que están
on
siendo tratados en estos países.
stem
Se hace una
cell
reunión de trasplante en Perú, con lo cual
related
se consolida
evidence.
la red y se
We
entregan los
consolidated
productos
the network
técnicos,
working
como
with Peru,
mencionaron, a fines
delivered
del año pasado.
technical
Y
products as
también logramos una
mentioned
publicación
earlier.
científica, lo
And
cual es
we
también muy
also made
relevante,
a
que
scientific
fue importante
publication
para poder mostrar
quite
este esfuerzo
relevant,
de
and
diagnóstico
it was
situacional
key to
realizado en la región.
share the
¿Cuántos productos tenemos? Son más de
situational
6, pero
diagnosis throughout the
quisiéramos
region.
resaltar lo
We
que fue el
have
diagnóstico
embarked in
situacional
6
con el
projects,
mapa
but I would
detallado de
like
la
to
oferta y demanda de
underscore
los
this
6 países.
situational
Se hizo un curso en línea de
diagnosis
trasplante
and
pediátrico,
the
abarcando todos los
mapping
tópicos
made
más
throughout the
relevantes
region.
relacionados al
An online
trasplante, tanto
training
como en
course
pretrasplante,
was
trasplante y
made where
posttransplantes,
we focused
con
on
una formación técnica
pre-transplantation,
certificada por la
transplantation, and
OPS para los equipos y con una
post-transplantation,
mirada
and
multidisciplinaria.
following an
Se hizo una guía
online
regional de
course
trasplante
by
con
PAHO.
indicaciones y
We
criterios de
created a
derivación
regional
e importantemente
also
incluimos algunos
we
aspectos que ya les
created
voy
a
a comentar
regional
con un
training
objetivo de
course
estandarización técnica para
for
asegurar el acceso
technical
oportuno, material
certification for
didáctico para
multidisciplinary
educación
teams,
de padres.
extended
Focalizándonos en
didactic
5 bloques
information to
educativos para
guide the
acompañamiento familiar,
parents
una
and
plataforma
the
para el registro de
families.
trasplantes
We
en la
created a
subregión andina
platform to
y un
register
plan de capacitación
transplantations throughout the
subregional para
Andean
profesionales.
sub-region and
Solamente
an
brevemente
online training
contar
course for
que el
professionals
diagnóstico
as well.
situacional
I would
nos
like
da un
to say
alcance
that
de toda la subregión
situational
andina, como ustedes
diagnosis
pueden ver en
provides
el
us
mapa, desde
with an
Chile hacia
overview
el norte con
of
todos los
the
países hasta
situation
Colombia,
throughout the
Venezuela.
region,
Tenemos un hallazgo
encompassing
de brecha
Bolivia,
crítica
Chile,
que ya se
Colombia,
mencionó,
Ecuador,
donde
Peru, and
existen
Venezuela.
capacidades de
The
respuesta
critical
del
finding
1,6% al
was that the
100% del requerimiento de
response
trasplante, lo
capacity is
cual evidencia
1.6
un
up
impacto
to
desde la geografía hasta el
100%,
estatus socioeconómico
which
para
is a
poder tener
clear
acceso
depiction that
y se genera la
geography
necesidad de un
and
puente
social
estratégico de
status
colaboración
are
sur-sur.
barriers
Los
to
centros
access.
establecidos en la región
We
pueden
created a
actuar
strategic
como
bridge for
mentores regionales
South-South
y
collaboration
amplificar esta
where there are
capacidad. Por
mentors
lo
now
tanto, esta
throughout the
disparidad en
region,
este cordón andino
and
entre esta
there's
cobertura del 100 y
disparity in the
1,6% nos
Andean
parece
corridor
absolutamente
because the
evitable y en el marco de CureAll,
coverage
el
that
compromiso
ranges
que
from
tiene el organismo
1.6 to
andino tiene a través de
100%
aquello de la
is
región
has a
una hoja
huge
de ruta para
gap.
cerrar esta brecha y
Therefore,
eso
we
es lo
created a
importante en el
roadmap to
contexto además
narrow down
de
the
un
gap,
plan andino del
which
cáncer.
matters
Y es así
especially now that
entonces
we're
como el curso
creating an
virtual ya tiene más de
Andean cancer plan.
3.862
The
profesionales
online
capacitados
training
de
course
25
has already
países, por lo
served
cual incluye algunos
over
países que están fuera, obviamente, de la subregión andina, y eso ha
3,800
sido muy
professionals
importante para
throughout
poder
the
iniciar este cierre de
countries,
brecha formativo.
which has
Tenemos
been
una guía regional
wonderful
que
to narrow
incluye
down
una
the gap.
introducción a datos
We have
históricos. No podemos
regional
olvidarnos de historia. El
guidelines
primer trasplante en
with
la región se hizo en
access to
Colombia, por ejemplo.
historical data.
La
The
importancia
first
que tiene que esto se visualice desde el mundo. Somos
HSCT
personas que hemos
was
trabajado
done
en este
in
tema durante
Colombia,
más de 3
for
décadas.
instance, and most
Hay
of us has
indicaciones de
been
trasplante en
working on the
pediatría que
topic
son
for
estándar,
decades.
otras que no
There
lo
are
son. Hay
standard
que enfocarnos
indications
en poder
for
subdividir estas
children's
por enfermedades
care. There
hematológicas y
are
no
other
oncológicas, ya que una
non-standard
enfermedad catastrófica,
indications, and we
un
must
trasplante lo
remember
abarca
that
todas.
catastrophic
Definiciones y
disease
clasificación de
is
trasplante,
the
criterio de
word when it
selección de
comes to
donante con una mirada
transplants,
moderna,
donor
estudios de
selection with a
pretrasplante y
modern
elegibilidad
view,
y regímenes de
eligibility
acondicionamiento y
criteria, and
también de inmunosupresión.
conditioning
¿Por qué esto es
regimes, including
importante? Porque ya
immunosuppression,
vimos lo que pasa
which
con los
matters
medicamentos
because we already are aware of what happens with high-cost drugs.
Therefore,
Therefore, we need all the medications to deal
Luego,
with
el
patients'
material didáctico ha sido
complications.
un material que lo que
Didactic
pretende es
material
empoderar a las familias y a los
aims
cuidadores.
at empowering
Está
both
preparado de
families
una forma
and
muy
caregivers.
didáctica,
These
con
materials
conceptos
were
iniciales, preparación integral,
prepared with
proceso de
initial
trasplante,
concepts,
cuidado de la
integrated
recuperación y futuro
preparation,
post-trasplante.
focusing
Y
on the
esto es
future
importante para
post-transplant as well.
finalmente sumarnos en la necesidad de tener registros
And we
de
must
los datos de
remember
trasplante
the
en la
need for
subregión andina. Y
registers
de acuerdo a lo que nos
throughout the
aprendió la
Andean
doctora Friedrich en
subregion.
el
And as
contexto
Dr.
del trabajo
Friedrich
regional en
taught us
Latinoamérica,
in the
es
context
importante
of the Latin
saber lo
America
que se hace a
region,
nivel macro en la subregión
we
andina,
need to
prácticamente
highlight what
con
is
una capa de
happening in
análisis
this
de módulos
sub-Andean
agregados
region by
de tracking y de
analyzing,
dashboards.
aggregating
Luego tener
aggregated
intrameso, que es lo
modules
que
in the dashboard
monitorea los indicadores
in
de
order to
resultados de
better
trasplante a nivel
monitor
país.
the
Y luego a nivel
transplant
micro, tener una mirada
outcomes throughout the
clínica
country,
directa en los
and at
centros.
the
Esto es muy
micro
relevante
level
para poder
to
ver cómo
focus
son
on
nuestros
the
resultados.
health centers, which is relevant to
Finalmente, el plan de
consolidate results.
capacitación
Finally,
subregional
the
para
training
profesionales de la
plan
salud que
for health
implique que tengamos
HCPs,
un plan de capacitación
which
posible,
implies
dada
having
nuestra
a
brecha,
training plan
implica tener
and
una
the
evaluación de los elementos
understanding of how
clínicos
wide the
necesarios, de
gap is
competencias técnicas necesarias,
to
de forma
bolster
multiestamental,
the
un enfoque
necessary technical
biopsicosocial y un
competencies,
enfoque de
a
cultura de la calidad. Ahora, es
biopsychosocial
importante que esto
approach,
se
as
enfoque
well as
también
culture of
para poder
quality.
formar médicos,
This all
enfermeras,
needs to be
farmacéuticos,
focused to
nutricionistas,
train
psicólogos, trabajadores
nutritionists,
sociales.
psychologists,
Y
nurses,
esto se
doctors,
mapeó
social
y es lo que tenemos
workers.
ahora en
All
mente
this
poder poner en
information was
marcha
properly
para
mapped.
poder
This is why we are
capacitar
currently
subregionalmente del año
implementing
2025 a
the
2027.
training
Ahora estamos en
program
una
throughout
fase
that
inicial
started in
cumplida y en una
2025.
fase de
It will end
implementación,
in
de evaluación con
2027.
certificación y la
We
sostenibilidad en el
just
tiempo que esto pueda tener.
completed the
Y
phasing
hablando de
plan,
sostenibilidad,
the,
aquí lo que
the
los
the
ministerios
planning
quieren que
phase, and
logremos
we're
a través
moving
de este
forward
trabajo
with the
colaborativo es
implementation.
una colaboración
The
sur-sur de
South-South
implementación de centros mentores
collaboration
y
aims
registros
at
nacionales de trasplante,
sustainability
el
to
paquete
implement
técnico regional de la
mentoring
OPS para
centers,
trasplante,
national
a través del
registers
trabajo colaborativo con
for
la OPS, con
transplants through
Horas Conu
working in
y con el
collaboration
Hospital
with
San Jude,
PAHO or
para poder
and St. Jude's
finalmente lograr
Hospital
integrar el
in order
trasplante en los
to
planes nacionales de
integrate
cáncer,
transplants and
lograr un
national
acceso
cancer
integral mejorando
plans
acceso
to
y reducción
manage
de tiempos de espera
integrated
en los lugares
plans,
donde ya existe
reducing
trasplante,
turnaround
tener
times and waiting
sostenibilidad
lines
financiera desde los
in the
países con una
hospitals,
propuesta
and to have
política
financial
para asegurar financiamiento a
sustainability with
largo plazo.
political
Esto fue una
proposals
parte
to
importante de
guarantee
haber analizado
long-term
todas las
funding.
políticas públicas
After
en los
analyzing all the
países para
public
poder apoyar
policies
en
throughout
esto
the
a la
countries,
mejor decisión con
we
centros
want
mentores para
to
poder
support
fortalecer la
the
colaboración sur-sur,
decision
con
makers
una
to
sistematización de la publicación
foster
electrónica de
South-South
mejores prácticas que
collaboration,
está también en línea
systemizing the
y una
South-South
calidad de
best
verificación
practices
continua
online
mediante el
guideline
monitoreo
through
de indicadores que yo
ongoing
les acabo
training and by
de comentar.
monitoring the
Y sin duda que hay
indicators
una
I
red
just mentioned.
también de enlace de
Without any
implementación de
doubt,
tutoría
there's
de alta
a
complejidad, donde ya tenemos el primer
mentorship
trabajo, obviamente con San
program
Jude, que ha sido muy
properly
importante, y
established
también
with St.
con el San Juan
Jude's
de Dios,
of
con
high
el Grupo
relevance, as well
Latinoamericano de
as
Trasplante,
with
el
San
Mundial de
Juan de
Trasplante, el
Dios,
EBMT,
the
y ahora
LAB
con la doctora Friedrich
MT,
estamos viendo
and
las
with
posibilidades
Dr.
de enlace con
Friedrich,
DKMS a
we're
nivel global.
wondering if we
Por lo
can
tanto,
also
está
work
el
together with
enfoque de poder
DKMS
aliarnos con
globally.
aliados
So
estratégicos, valga la
it
redundancia. Nuestro objetivo es aumentar la
creating
tasa de
partnerships
sobrevivencia en
with
niños, niñas y
strategic
adolescentes a lo menos un
allies
60%, y
is in
creemos que
our
este proyecto se
pipeline.
enlaza
We
absolutamente
believe
con JCC
that increasing the
Accelerator a través
survival
del
rates of
fortalecimiento del
children with
trasplante de
cancer
progenitores hematopoieticos en la
by at
subregión
least
andina. Ustedes pueden conocer
60%
en
for
este QR
2030
más de este
will
proyecto.
improve their
Y
quality of life.
solamente dar las
You
gracias
can
a todo lo que
access the
se ha
QR code
logrado
if
a
you
través
want
de
further
este
information. I
trabajo
just wanted to
conjunto.
say
Muchas gracias.
thank you for the joint efforts.
Increíble y muchísimas gracias, la doctora Julia
Amazing.
Palma,
Thank you, Dr.
Luis
Julia
Bengolea,
Palma. Thank
para
you, Dr.
mostrar todos
Luis
los avances en
Bengolea.
este proyecto
Thank you for
subsurso del
sharing
trasplante.
all the
Y
progress
quiero
made in
enfatizar
the
la importancia
South-South
de
project.
tener
I would like
Horas
to
Conu como
underscore how
el eje
important it is
central
to
en esta
safeguard the
iniciativa,
golden
porque
hour
realmente
at the core of
está
this initiative,
impulsando el compromiso político y la
because
integración
it is
regional
a
y
token
esta
of
cooperación
political
entre países,
commitment,
porque de la
regional
perspectiva de salud
integration,
pública siempre
and
podemos
what
lograr
happens when we
resultados
work
cuando hay esta
together.
voluntad política
Better
detrás de
outcomes are
todos
achieved when
los
there is
proyectos
political will
técnicos. Así
behind
que
technical
muchísimas gracias a
projects.
todos
Thank
ustedes
you
y por
very
supuesto a
much
nuestra moderadora
to all
Claudia
of
por
you, and thank you to our
dirigir esto.
moderator,
Bueno,
Claudia.
seguimos
Let us keep on
en el tercer
going,
bloque sobre atención
and we'll
psicosocial y
move
apoyo a
forward
las
to block
familias.
3 free on psychological and social care and support to the families. I give the floor to our moderator, Dr. Soad Fuentes Alabi from St. Jude Children's Research Hospital.
Gracias, Silvana. Y bueno,
Thank
vamos
you,
a dar
Silvana.
lugar al bloque de atención psicosocial, que
Next, the
sabemos que
psychological and
es un
social
elemento clave en el
support for
manejo
families
multidisciplinario del niño
module,
y
which is
las
key
niñas y
in the
adolescentes con cáncer.
interdisciplinary
Y
care
recuerden
of
que les
children
hablé
and
de
adolescents
del
with
proyecto de
cancer
la maleta de Emily.
care.
Este es uno
Remember
de
I
los
mentioned the
últimos proyectos que se
Emily's
han lanzado.
Bag
Están
project.
disponibles
It
en
is
la
a
página de
project that was recently
IVOS
launched. You can
de
find it
OPS
at
y ha
the
sido un
PAHO
trabajo
ERA's
en
website.
conjunto y en
This
colaboración
work was made
con la
jointly
Fundación Ayúdame a
and
Vivir
in
del Salvador,
collaboration with
liderada
the
por el
El
licenciado
Salvador
Álvaro
Ayúdame a
Morales
Vivir
Lugo,
Foundation,
quien
led
es
by Dr.
psicooncólogo
Morales Lugo,
trabajando
a
en Fundación Ayúdame a Vivir
psycho-oncologist
del
who
Salvador
works
y
at
el
the
que ha
El
liderado
Salvador
el
Ayúdame a
desarrollo de este
Vivir
material con el
Foundation. He
equipo
led the
de
development of these materials
psicooncología
with
del
the
Hospital Green y Fundación Ayúdame a
psycho-oncology
Vivir.
team
Adelante,
at the
licenciado
Ayúdame a
Álvaro
Vivir
Morales.
Hospital.
Buenos
The
días a
floor is yours,
todos.
Dr.
Qué gusto
Morales.
saludarlos. ¿Sí
Hello,
me pueden
everyone. I'm
confirmar
so
si me
pleased
escuchan
to
bien?
see you. Can you just confirm that you can hear
Sí,
me
se escucha
properly?
bien. Adelante.
Yes.
Gracias. Bueno, buenos días. Y gracias
Good
al
morning,
equipo de la
everyone, and
iniciativa
thank you to the
global contra el
team of this
cáncer
global
por esta
initiative
invitación. La verdad es que
of
hoy es un día bastante alegre
World
porque
against
podemos compartir
the
todos
World
los
Initiative Against
avances,
Childhood
los
Cancer.
logros, pero
We're
también
so proud to
sentamos
share
las
progress
bases
and
para
also
el
achievements,
futuro de
but
los
also
niños y
we set the
adolescentes con
basis for
cáncer
the future.
en
How we're
nuestra
going to deal
región.
with patients
Yo
in
soy
our
Álvaro
region.
Morales, soy
I'm
psicólogo
Alvaro
clínico,
Morales. I'm a
trabajo en
clinical
Fundación Ayúdame a
psychologist.
Vivir,
Psychologist.
una
I
única
work with
organización que provee
Ayúdame a Vivir,
servicios sin
Help Me
costo
to
para
Live
los niños,
Foundation. We
niñas y
provide
adolescentes con cáncer del
free care
país.
for
Bien, en
children
esta
with cancer
presentación
in
que
the
trata de la
country.
atención
This
psicosocial y apoyo a
presentation
las
deals with the
familias,
psychosocial care and
quiero
support for families.
enfocarme en un
Let me
proyecto que
just
lanzamos recientemente
focus
que
on
se
a
llama La
recent
Maleta de Emily.
project called La Maleta
Dentro
de
del
Emily,
proyecto
Emily's
psicosocial existen
suitcase. So
muchas
as part of the work that we
iniciativas y
do, we
muchas
have a lot of
acciones, como por
initiatives and
ejemplo
actions, like, for example,
los estándares psicosociales, la
the
comunidad
psychosocial
científica de
standards,
OPCA,
the
pero
community
la
of
maleta de
OPCA,
Emily
but
es una de
the
las estrategias
suitcase
que
of
se ha
Emily, this is one of
trabajado
the
desde hace
strategies that
ya
we've
algunos
worked on
años y que
for
finalmente
many
hemos
years already,
podido
and finally we've
lanzar
been able to
y está
successfully
enfocada en
launch
la
this
educación a
book. It's
pacientes y
focused
sobre todo
to
en la
kids,
promoción de
well,
la adherencia
children,
al
and
tratamiento.
also to promote that they adhere to
Nuestra
treatment.
experiencia
So
sí que
our
nos ha enseñado que el cáncer
experience has
pediátrico es
shown
una
us that the
enfermedad que va más
pediatric
allá de la complejidad
cancer goes
biológica
beyond the
del
biological
paciente, pero
complication
también de
of a
la
patient,
realidad
and
social de
it
las
goes
familias.
beyond
Como
the
decía
reality of
la doctora
families.
Vázquez hace un
As
momento, uno de
Dr.
los
Vasquez
retos
was
más
saying, one
grandes
of
que
the main
enfrentamos en la
challenges
región
that we
es
face
el
in the region
abandono
is
del
that
tratamiento,
they
que es
do
uno de
not
esos
stick to
factores
treatment.
que son
This is one of the
modificables
main
y que
factors, and we can
habiéndolos
modify this, and once
abordados
that we've been able to
facilita
address
y
them,
promueve
it really
la
facilitates
recuperación.
and promote healing.
En países
Now,
de
in
medianos y bajos
countries
ingresos, una de las
of
principales causas
middle
de mortalidad.
and low income
Entonces, la maleta de
countries, this
Emily,
is one
teniendo
of
en
the
cuenta
main
esto,
mortality
hemos
rates.
creado
So
este
with
proyecto que
this
es un
book, we have
conjunto de
created
recursos
a group
educativos
of
que está
educational
orientado para
resources
tres segmentos
that
de
are
edad.
focused for
Para
three
niños de
segments,
4 a 7
for kids
años,
from
para un
4
grupo
to
de 7 a
7
11
years,
años y un
from
grupo de
7
12
and
años en
11, and
adelante.
also 12
El
years and
criterio
beyond.
para separar
Now, the
estos grupos
criteria in order to
por este
separate these
conjunto de
groups
edades en
by this
específico es un
age group
criterio
of
meramente
ages is
psicológico
just
y tiene que ver con
psychological,
que en
and
estos
it has to do
segmentos
with the
la
fact that in
capacidad
these
para
segments, the
comprender y formar
capacity to
conceptos
understand and to
es muy
form
similar. Los
concepts is
niños de,
very
de
similar.
4 a
I
7
mean,
años
kids from
entienden
4 to 7 years, they
la
understand,
información
for
de manera
example,
muy similar,
information in a
pero muy
very
diferente
similar way,
al
but
grupo de
different
7 a
from the
11
group of
y los
7 to 11,
adolescentes de otra
and
forma. Por lo
adolescents in
tanto,
a different
basados en
way.
este
That is why
criterio,
that based on this
decidimos
criteria, we
segmentar la
decided
información.
to
Ahora bien,
divide the
el
information.
contenido de los
Now, the
materiales
content of the
aborda
materials
para todas las
addresses
edades
for
la
all
definición del
ages
cáncer,
the
cuáles son los
definition
tipos de
of what
cáncer,
is cancer,
las
types of
modalidades de
cancer,
tratamiento más frecuentes
treatment, the most
disponibles en la
frequent
región,
treatment
quimioterapia, radioterapia, la
ways,
circunvalación neooncológica.
radiotherapy,
Se abordan los
chemotherapy.
efectos
We
secundarios
talk
del
about the
tratamiento,
side effects.
los roles de los miembros de los equipos
What are the
oncológicos,
roles
las
of the
dependencias de los
physicians,
hospitales y los
the
insumos y
things
equipos de uso médico
in the
más frecuentes en
hospitals, and
oncología
also the
pediátrica.
most
Así
common
que, básicamente
equipment
premisa y el
in the
objetivo de la
oncological
maleta de
treatment.
Emily es
In this
formar en las
book, the
familias la
idea is to be able
convicción de que el
to try to
tratamiento
work with
es un
families and
tratamiento
to
de por
understand,
vida
help them understand understand that this is a medical treatment, and this is why
se deben seguir las
they
indicaciones
need
de los
to
equipos
follow
oncológicos.
all
Las
the
indicaciones y las
indications from
recomendaciones
the physicians,
a través de la
recommendations, treatment,
narrativa y del
care.
encadenamiento de la
And
información
by
se
means
va
of sharing
llevando al
this
paciente desde la
information, we can
situación
take
actual
patients
hasta
from the
cómo
current situation
todas las acciones,
until
seguir
all the
las
actions that they need to
recomendaciones, tomar la
perform what are the things that they need to do? Radiotherapy, chemotherapy, the cath ports, for example, they need to learn that these are important actions in order to be able to heal, because that's what the end purpose is, of course. Now, the creation of the materials that we already have available, these are available in our webpage. You can go in and print it. The idea is that we want to work on formats that can be easily print, accessible to everyone, but that they're also interesting. Now, the materials were created through a consultation and validation process that has been extremely interesting, and we received great support from all the region. First of all, we wanted to share scientific information, and this information was verified by two multidisciplinary panels. One of the panels was a local panel here in El Salvador, and the other one was formed by oncologists, nurses, psychosocial teams, communication teams from all the region, PAHO, St. Jude's, who gave us a very important feedback. They gave us information that it was very valuable in order to adjust some of the information that we were publishing in those documents. So it was positive in general. Now, language. We needed to use an accessible language. When you want to share raw scientific information, sometimes it's difficult to understand. So once that we use accessible language suitable for the ages, we can help them to understand really what this is about, what their disease is about, their treatment, and why everything that we do or it's done, it is only focus on them healing. We wanted to have also information that could be presented in a playful and interactive way. We want the children to be able to interact with whomever is presenting the information. And it was there's something important here. It's not only about taking some printed material and just give it to them and read it. No, no, no. This is an encounter that helps, for example, the volunteers and the pediatrician and the oncologist to work with the families, to be working as a team. Now, the physical support, this is versatile and accessible. This could be printed both in special paper, also bond paper. This could be printed in gray colors or in color. This depends on the possibilities and the preferences of each one of the teams, of course. But what we try to do is that they are all in a brochure format and that they could be easy to print and to hand out. Now, in order to be able to present this book, we created a training manual for the volunteers. That is for those who are going to sit down with the children and they're going to talk about cancer and they're going to explain their treatment and what this is about, what are the procedures that they're going to be subject to. They can do it in the most, empathic way, that they can provide easy information or user-friendly information. They can create a relationship with patients. And most importantly, information, this is not like cold information. We try to address the emotional needs of all patients by giving them, for example, information on how to face this, validating their emotions, and give them some tips, like, for example, mark in a calendar how far they are from the last day of treatment. Here we have some images, for example, the Great Labyrinth. This is a whole narrative because this Great Labyrinth, it says, for example, the hospital is like a labyrinth. This is a huge challenge that your labyrinth, they're going to be able to know. And these are the notes that you will be able to go one step and a step, and you will learn all the areas and what are the different things that we have to go through. This is how we work with them. Because we as physicians or health professionals, we are familiar with all this, but someone who is new to this, parents and children, they have no idea what we're talking about. So I invite you to go into the PAHO webpage. They have created a great landing page that you can access all the documents, and also a story of one of our patients who participated in the book, and now she is in her surveillance stage. She's growing and she's been healthy so far. So this project, then you will ask, okay, why Emily's backpack? Well, that's why, because Emily was a girl who is an amazing girl who adapted perfectly to her child, to the treatment. The family was there, they adhered to treatment, and we think about her of a very lovely girl. She always talked to everyone. She wanted to share things with other patients, with nurses, with the doctors. So that's why somehow we wanted to pay an homage to her memory, because when we were designing the program, the project, she lost her life. So this is why we use her name in memory of everything she did for us when she was here with us. And that's the project that I wanted to share with you.
Muchas gracias, licenciado Morales.
Thank you, Mr. Morales. Doctora Vázquez
Colocado en el chat, los enlaces para
has shared on the chat everything that you need to go to the story of La Maleta de Emily, or this work that we have just heard. And this goes together with
con la parte de los diferentes etapas de atención
following the different stages of psychosocial care. And Dr. Viviana Trigoso has developed an excellent materials and groups and talks and different talks. And this is one of the psychosocial modules, that is information and education. So let me give the floor to her, because she will be talking about these different modules, psychosocial care in pediatric cancer. So I pass the floor to you, Dr. Viviana. Welcome. You have the floor now. Thank you, everyone, and it is a pleasure to be here with you today. So now let me talk to you a little bit about this project, psychosocial care. As you've heard, we work together with Maleta de Emily project. So let me just make sure that you can see my slide. There we go. As an introduction, what do we mean by psychosocial care? Let us understand that this is the set of actions and resources that encompasses psychological, social, spiritual, and functional dimensions. Something very important to say is that there are different international standards for this, and also the International Oncology Society refers that the access to psychosocial care needs to be considered as an universal right. In order to include this is necessary in all the care in terms of oncology. Why? Because these allow us to be able to help patients to adapt, to promote well-being, quality of life, and to be able to help them and to prevent comorbidities in mental health and to reduce emotional suffering, of course. So this is why we have this project, psychosocial care in pediatric cancer. What are we looking for? That everyone, all children and adolescents with cancer and their families, have access to care psychosocial while strengthening quality and comprehensive care. This project was born in my country, in Peru. This is a participatory project that collected national evidence and the situation of our country, with the purpose of setting an example, and that we could expand this to other countries. So it is expanded to Latin America and the Caribbean, and by being approved by different professionals. And there is a path that you can go over in the article that has been published, and you have the code there. Something else that I wanted to tell you is that the main objective that we are pursuing, and this is why we're going to work with other projects, the idea is to strengthen the implementation of regional standards of psychosocial care, that they were developed by generating evidences. How can we want to strengthen this? By generating more evidence. Our region sometimes has not been able to support evidence of the best practices of the psychosocial support that we provide. Also, we've been moving forward in developing practical tools, and we are now working in providing technical support for countries if they want to be part of this implementation process. As I was saying, we have some adapted standards that considers the first four, the key services that they need to, all but pediatric patients need to access treatment and after treatment. Also includes, for example, what are the psychosocial competencies so that we can provide the multidisciplinary care, and also the transversal focus in order to be able to provide a psychosocial care focus to life, gender rights, and interculturality. Let me just share with you the webpage. You can have access there on the chat. Let me just share this, and you will be able to go into different resources. The idea is that we will be updating this webpage with resources. As part of this, we also show some of the progress that we have in the region, and one of the main materials that we have as the technical included package, we have the modules on psychosocial care. These are 6 technical documents that are translated into English, Spanish, and Portuguese, and allow you to learn about key information of each one of the standards, and also to have some standard practices to implement all of these. So I like to thank the great team. We have more than 30 members from 15 countries. We hope that we have more countries joining us. And in order to give you what are the main features and to understand the region, what are the things that we've been working on, we will be showing a brochure document that is a call for action that includes key information. How can we start implementing all the standards? We are also gathering the best practices that are aligned to the standards and that we've been seeing that they are implemented in the region in order to be able to have a document like a toolkit with the best practices to document evidences that from there we can focus on new initiatives to develop an implementation matrix that will be useful for all countries, and of course to be able to articulate different efforts from all countries. The project is possible thanks to the different supports and alliances that we had with other professionals, also by means of including patients and their families as part of this project. Let me say that we have this alliance with the project of La Maleta de Emily, also the Red of Survivals, Red de Vida, OPCA, and we invite everyone else to be able to be part of this project so that we can strengthen the psychosocial care in patients and families. Thank you. Thank you, Ms. Trigoso. Thank you so much for your presentation. Now I'm going to pass the floor to Patti Logueto. She's going to be our moderator for this block. Thank you, Suad, and welcome everyone. Thank you for being here with us. My name is Patricia Logueto. I am the focal point in the country in St. Jude's Global in the program part of the St. Jude's Children's Research Hospital, and I'm so happy to be here with you moderating this Block 4. So we will share the work and the resources that we provide in childhood cancer survivors. Now, as we mentioned at the beginning of this webinar, the idea is to be able to support this global initiative and to find different areas of opportunities. As part of this was the survivors. And this is how we created this regional survivor task force, and I will give you more details. And the objective of this is to evaluate the current status and to identify needs and then to develop materials depending on the childhood cancer survivors in Latin America. Now, this task force is formed with the network Faros de Vida. This is Latin American Network of Childhood Cancer Survivors, and we have seen a great expansion in the last years, reaching to almost 17 countries with 12 national representatives and 220 active members. And in a couple of minutes, you will be hearing a little bit more about the way that they work and what they do. But what I wanted to say is that as part of this technical package, we have different resources for survivors, specifically an information package. We have a manuscript with perspectives on health and outcomes and information needs. You can see, for example, the results of this document and something that another one that we're working, the two infographics that we have on the left. Also, we have the information. You can read the perspectives of qualitative and impressions, insights on lead effects, and also we have a campaign in social media. You can follow us in Instagram. This is a wonderful campaign that we have for this month. And in order to talk to you a little bit more about this great group, let me invite our friend Ana Azurieta. She works in San Juan Hospital. And she's going to present in a video. Thank you so much, doctor, for this. And now let me pass the floor to you.
No se escucha, Patricia.
We cannot hear you, Patricia.
Perdón, me dijeron que no se escucha. En un momento lo voy a compartir.
Give me just 1 second.
Equipo, perdón, estamos con unos problemas técnicos con el
We
sonido,
apologize.
así
We are
que si me permiten,
experiencing technical issues
lo
with the
resolvemos,
sound.
me gustaría invitar a Carlos,
In the meantime,
Carlos Frías, de
Carlos
la
Frias
Red Faros de Vida para
from the
su
network
presentación. Un momento.
will give his
Carlos, por
presentation and
favor.
we'll be back.
Muchas gracias por estar acá con
Carlos,
nosotros.
thank you for joining us.
Hola, hola.
Hello.
Buenos días, tardes.
Good day.
Bueno, gracias. Para mí es un placer poder estar aquí, un honor
It is such a pleasure
presentando
and
estos
honor to be
materiales
here
que son un trabajo
sharing these
colaborativo, como ya
materials,
mencionó Patti, de
which
este
are a
grupo de
collaborative
trabajo
effort of the
conformado
working group,
por
as Patty mentioned,
el Hospital San Juan de Dios, San Jude,
made up by St.
OPS
Jude's,
y
the
Faros de
San
Vida, que ha
Juan
sido
de Dios,
toda una
PAHO,
experiencia
Faros de
gratificante y
Vida,
enriquecedora poder
as an
participar
alliance.
de
It's
este
been
grupo.
a rewarding experience to be
Y
part of
bueno,
this group.
para presentarme un poco más, mi nombre es Carlos Frías, soy de
My name
México
is
y soy
Carlos Frias
sobreviviente de una leucemia
from Mexico.
linfoblástica
I'm
aguda.
a survival
Me
of
diagnosticaron a
acute
los 7
lymphoblastic
años.
leukemia
Actualmente tengo casi
diagnosed at
28,
age
o sea que ya
7.
tengo más de
I'm
10 años como
almost
sobreviviente.
28 years of
Pero desde
age,
mi trabajo como
so I've
líder
been
de
a
esta red
survivor for a
y
while.
con mi
As
experiencia propia
the
como
leader
sobreviviente,
of the network and in my
hemos
experience
detectado
as
y
a
me he dado cuenta que
survivor,
existen muchas
we've detected
necesidades dentro de la comunidad de
that there are
sobrevivientes que
many
empiezan
needs amongst
específicamente a
the
partir
network of
de que se da el
survivors,
alta clínica.
and those needs start
Porque,
when
claro,
the clinical
hablando
discharge is
específicamente del
given.
tema que vamos a hablar hoy,
Speaking
a partir de
specifically
que
of today's
se
topic,
hizo una investigación con este grupo de trabajo y detectamos
this
las principales
working group
necesidades de los
did its
sobrevivientes.
research and we detected
Hablando de
the
la
survivors'
información,
main
encontramos
needs.
que el
So when we
88.7 de los sobrevivientes
it
reportaban necesitar
saw the
orientación respecto a los
information,
efectos
we
tardíos
detected that
y los cuidados. Y
88.7%
esto,
of the
más que
patients
una cifra,
needed
también refleja
information of
una realidad
late effects
peligrosa,
and
podría
care.
decirlo,
This is a
porque
reflection of a
claro,
dangerous reality, I
la
must
mayoría de
say,
nosotros,
because
como
of
bien lo
course,
refleja
most of us,
el estudio y como lo
as
hemos
the
experimentado
study
quienes trabajamos con
reflects
los
and
chicos,
as of
muchas veces,
those
o
of
la
us
gran
who
mayoría de
work
veces, los chicos
with
no
the kids
saben,
have experienced,
recuerdan el nombre de
most
su
of the
terapia,
times the
saben el
kids
nombre de
may
su diagnóstico,
remember the name
pero
of
más
their
allá de nombres no tienen
diagnosis, the
realmente
name of
información
the
respecto a
therapy,
que
but
X
they don't
quimioterapia
have much
afecta más al
information
hígado o
exactly
al corazón,
about
o que si
their
recibieron
impact on their
radioterapia
heart, their
enloquecedora,
liver, if
que
they
tienen
got
que tener cierto
radiotherapy in
cuidado.
a
Y
certain
esta clase
organ,
de
certain needs or
Esta clase de
care
falta
is
de
required.
información abre
So
la
this
puerta a que
lack of
durante su
information
desarrollo como sobrevivientes y teniendo en cuenta
affects
que hay
their
secuelas físicas que
development
surgen
as
años después del
survivors,
tratamiento,
and there are
los primeros
physical
síntomas o
sequels that
señales de
may
estas afectaciones
arise years
sean
after
pasadas
the
por alto
treatment.
al no tener la
So
información
this
o
information
al no
goes
estar
unnoticed because of lack of information, because they do not pay special attention to those areas of their body because of lack of information. And it's not that that information doesn't exist. It does exist and it is of a good quality, but oftentimes that information comes in different languages or written in technical with technical terminology, and they really don't have access to the St. Jude portal, which is in English, or they have a hard time reading long documents. So if we want to, aiming at closing down the information gap, we focused on developing a document that adapts the scientific knowledge and customizes the information, but does not only provide information, but a guide of advice on what HCP to go to if you feel overwhelmed or if you're fighting a sequel. So the youth can get a hold and it can be in control of their symptoms, whether physical or psychological, and they can be the stewards of their disease. So this is not only just presenting information, but presenting it in a certain way. We focused on design because we didn't want to share overwhelming information. We didn't want it to be stressful. We wanted that their knowledge about sequels would be didactic in order to alleviate their feelings and having access to information. We didn't want to create an extra burden. It's been a pleasant surprise for us to see how these materials have been shared and how the youth have welcomed them, because in this year's International Child Cancer Day campaign, we started sharing materials in January, in mid-January. The speaker sound is intermittent. The interpreter apologizes. So all these materials had reached to over 11,000 people, but by February 15, around 15,000 people had received these materials, and they were not necessarily people who followed the website, but they were patients who needed to have access to this information without necessarily having logged in previously. These materials were not only developed to build a social media campaign, but all these materials were created to be properly used and disseminated to all the youth. So this information is not only available on social media, but at the Faros de Vida website. We're leaving the website on the chat. We kindly invite you to look into it because we want these materials to get distributed to all hospitals, institutions, associations, everywhere where there's a youth who may need this information should be guided on how to live their lives post-treatment. We call it elevating anchors. And we decided to call it that way because we know that this is just the first step to deliver the materials and the necessary data, the necessary information, so the youths can be fully independent to take control and take charge of their lives, their decision, and their health. We hope that we will expand this information, and the next time around we can share even more materials. There are 16 main areas of focus. Some of them are related to late effects and the psychological aspects of the disease, and how each youth can use this information depending on their needs at a given point in time.
to
conocimiento
provide not
técnico
only
respecto de la
a
enfermedad, sino
technical
también de cómo atender
knowledge
también
guide on
esas
how to deal
cuestiones
with the
psicológicas
disease,
que
but
hemos
how
visto que
to
son
address the
de lo más
psychological
mencionado
considerations
por
as
los
well,
chicos de
because
nuestra región.
it's what
Y sin más,
the youth throughout the region
solo volverlos a
have
invitar a que
mentioned are
entren,
the more
vean el
significant
material, lo
aspects to them.
conozcan,
So
lo
we kindly
descarguen, lo hagan
invite
suyo, lo
you to
compartan y que
download
llegue a
these
todos los
materials,
lugares
to share it with
donde pueda servir.
everybody so this
Estamos
information
esperando
can
a que
reach
próximamente se pueda traducir al
everybody.
portugués también
And
y
we're
al
aiming
inglés
at translating these
pronto.
materials into
Muchas
both
gracias.
English and Portuguese in the near future.
Muchísimas
Thank
gracias,
you.
Carlos, por
Thank you,
compartir
Carlos. Thank you for
y por los
sharing.
lindos recursos.
And thank you for,
Voy,
thank you for sharing all these
como que
wonderful
gracias por la paciencia
resources.
con
Thank you
las
for being
dificultades técnicas,
so
pero tenemos
patient
acá la
with our
grabación de la
technical
presentación de la doctora
difficulties.
Ana y
We are now ready to
que la
share
voy a
Dr.
compartir ahora con ustedes. Un
Anna's
momento.
presentation. Give me just one sec.
Yo sigo con el problema. No sé si puedes intentar
I'm
compartir
still
desde
experiencing issues. Can somebody help me?
Ahorita comparto.
Muchas gracias. Perdón.
I can
Y
share this.
a nuestra
I can
audiencia.
share the
Gracias por la
video.
paciencia.
Thank you, and our apologies to the audience.
Déjame ver.
Hold on a minute.
Parece que tampoco me deja compartir audio. No sé por
It's
qué no
not
parece
allowing me
como
to
que
share the
Si
sound
desean, por
either.
favor, pongan el video en speaker,
You
no
can
por los audífonos, pero en speaker, lo ponen en
play
volumen
the
alto y
video
dejan su micrófono abierto, así
on
todos podemos escuchar.
speaker mode and
Ok,
leave the
perfecto.
microphone
Gracias.
open.
Déjeme poner
Maybe
todo
it'll
el
work that
volumen.
way. But the interpreter apologizes
ahorita
because
comparto el-
sound must
¿Ven,
come
ven el
through
video?
properly for proper interpretation.
¿Lo logran ver?
Can you
Ya
see
lo
the
tienen.
video? Click play.
Sí, sí se puede ver.
Con todos, mi
We can see
nombre
it.
es Ana Carolina
Pero
Alcibieta, soy oncóloga pediatra del
Sí,
I'm
se
a
escucha, Suad. Muchas gracias.
Es esto donde es importante incidir porque es a largo plazo. De este hospital que se enfoca principalmente en el seguimiento de los pacientes que han
We're
superado un
focused
cáncer,
on follow-up
principalmente en
of
materia de prevención y de detección de las
survivors
secuelas a
of
largo plazo.
cancer to
Y a
protect
raíz de este día
outcomes.
conmemorativo del Día Internacional del Cáncer Infantil,
The interpreter
gracias
is
a
trying
Liliana y a los
her best
organizadores, tengo el
with
honor de
poor sound
presentar
quality.
el trabajo que hemos ido haciendo como equipo para mejorar la atención del superviviente de cáncer infantil en la región. Siempre me gusta empezar con esta diapositiva
This is the
que muestra
slide
cómo
I
han
often
empezado,
resort
¿no?
to start
Gracias
any
al liderazgo de la
presentation.
doctora Liliana Vázquez, en junio
It
del
is important to
2023 se creó
thank
este equipo
Dr.
que es
Liliana
el
Vasquez, who
consorcio
created this group,
latinoamericano para
the
trabajar
Latin
en materia
America
de superviviente de cáncer infantil en la
Consortium,
región. Es un
which was
equipo tan
created
valioso
in 2023.
que junta diferentes visiones, que nos permite
This
ser un equipo
consortium gathers
multidisciplinar,
different
no
perspectives.
solo
It's
se
made up by a
lleva por oncólogos pediatras,
multidisciplinary
sino que se
team
enriquece de
that
la visión
involves
también de psicólogos,
pediatric
de enfermeras, de
oncologists,
diferentes equipos. Pero creo que lo
psychologists,
más valioso que
nurses from
tenemos es
different
que
institutions.
trabajamos de la
The
mano
most valuable
con la mayor red
aspect is
regional en
that we
Latinoamérica,
work
que es
and
Faros
we
de
have
Vida, que es la
with
voz del
Faros de Vida, the
superviviente. Y es
largest
esto donde es
network
importante
throughout Latin
incidir porque
America.
es
This is
realmente
key
valioso tenerlos a
to
ellos dentro de
remind
nuestro equipo para
that
poder saber dónde
they're
empezar a
a
trabajar
key
y
aspect
cuáles son las
to our
necesidades
work
prioritarias en
because
la
they
región.
have focused our
Cuando
needs and
empezamos a
priorities.
trabajar,
When
empezamos
we started
pensando, bueno,
working,
es una región
our
bastante,
first
bastante
thought
amplia, ¿no?
was
Latinoamérica es
that
amplia,
Latin
es
America
heterogénea, con
is a
diferentes sistemas
huge,
de salud y era
heterogeneous,
necesario
and
definir y
diverse
mirarnos
region
dónde
with
empezar a
different
poner el foco
needs.
como equipo.
So
Es imposible
priorities
abarcarlo todo
had to be
y
defined
es
because
verdad que
it's
existen, bueno,
impossible
regiones
to deal
bastante
with
dispares
everything
en las que no existe
because
nada, ni
of
siquiera
the
conocimiento, y en otras en las que
disparities as
puede haber
well.
algún
There
tipo
are
de
areas
iniciativa.
where
Para esto empezamos
some
con una serie
initiatives
de
may
métodos
already
mixtos,
be in place and
sobre todo
other
para
areas
planificando con encuestas y
where
entrevistas, siguiendo
knowledge is
métodos
scarce.
pues, de puestas que ya se hacían y que se hacen en grandes estudios en Norteamérica y bajo la expertise de diferentes oncólogos
With the
pediátricos
expertise of
que se
different
enfocan en el seguimiento a
pediatric
largo plazo, pues
oncologists that
pudimos lanzar
follow
este
up
primer proyecto
survivors,
que
we were
llegó a
able
buen
to
puerto.
launch
Y
this
realmente
first
descubrimos cosas muy
project.
interesantes.
We discovered quite interesting things.
Recibimos 135
We
respuestas
received
de 16
135
participantes de 16
responses
países
from
de América Latina con una
participants
media de edad de
throughout
26 años.
16
Era realmente
Latin
una
American
cohorte bastante
countries.
joven.
The age
Destacar eso,
average
que no
was
es una
26
amplia
years
participación.
of age. It
Realmente
may
nos
not
permitió tener
seem
una primera
as a
fotografía de
broad
cómo estamos
participation, but it
en
does give us a
Latinoamérica, ¿verdad? Y
snapshot of the
descubrimos
Latin
que
American
los
situation.
problemas de salud
We
mental son
discovered
ampliamente
that
prevalentes. El
mental health
61%
issues are
de los
prevalent.
pacientes que respondieron, de los
61%
supervivientes
of
que respondieron,
responders
presentaban problemas de salud mental,
had
principalmente
mental
ansiedad y depresión. Hasta el
health
58%
issues,
de los
mainly
dos tercios
anxiety and
tenían algún
depression.
problema endocrinológico,
2/3 had
principalmente a destacar que el 69%
endocrinous
reportaba tener
conditions.
infertilidad. Debo destacar que esto es una corte joven y hasta el
Around
32% desconocían
17%
el estado de
infertility,
fertilidad. Es
and
decir,
this
un
is a
tercio
young
de estos
cohort.
pacientes
1/3
desconocen
of the
si el
patients
tratamiento que recibieron
do not
pudo
know
haber
the treatment
afectado
they received
pudo haber afectado
may
su
had
capacidad de ser
may have
padres o madres.
affected their
Realmente esto es una
ability
falta de
to
información.
conceive. So this is a
42%
reflection
reportaban
of
problemas
clear lack of
cardiovasculares y hasta el
information.
32% reportó problemas neurocognitivos.
42% reported
Y vimos
cardiovascular
también
conditions
preguntar
and
sobre la
32%
capacidad de
reported
acceso, ¿no? de
neurocognitive
acceso a médicos de atención
disease.
primaria, a este seguimiento
Access
y
to
también acceso a
primary
atención
care,
psicológica.
lack of
Y
access to
pudimos ver que
primary
un
care and
tercio
lack
de
of
estos
access to
pacientes
mental
tenían un seguimiento
health
médico
care
regular
was
o
also
acceso también
reported.
a atención psicológica y dos tercios carecían de apoyo
2/3
educativo tras el
did not
cáncer.
have
Quiere decir que
any
de
type
todos
of
estos pacientes,
educational support
solo un tercio,
post-cancer.
30%,
Only a
podían
third,
tener acceso
or
a su médico de
30%
atención
of the
primaria.
patients,
Pero
had
esta vez
access
no
to
sabemos si
primary
este
care.
médico de atención
And we don't
primaria pues
know if the
realmente está
primary care
informado o
doctor
formado cómo hacer el seguimiento a
was
largo plazo
properly
de
informed
los supervivientes,
on
¿no? Lo que es muy
long-term
importante
treatment
también.
of
Entonces, este fue
survivors.
un primer paso que dimos
This
con
was the
gran
first
éxito para
step
entender estas
we
necesidades
took
regionales,
to
para
better
saber hacia dónde
understand the needs
focalizar
throughout the region
todos estos
in
esfuerzos. Y
order
sabíamos
to
que era
allocate our
importantísimo empezar a
resources
trabajar
and
en
efforts.
acceso a la
We
información
knew
y
that
en el
it
acceso al
was key
seguimiento,
to
y
start
sobre
working
todo
on
en
access
salud
to
mental.
information and
Para
access to
mejorar el
follow-up,
acceso a la
mainly in
información hemos
mental
trabajado en
health.
infografías
We
gracias a la
developed
EPS y a la colaboración de
infographics
Liliana, sobre todo, para poder sacar este trabajo a la luz, ¿no? Poder sacar qué es
to
lo que estamos
publish
haciendo, qué es
our
lo que hemos
work,
mirado, qué es lo que hemos
to
descubierto y
showcase our
sobre todo
work,
trabajar en
our
materia de
findings,
educación
and
y
to start
recursos para los
working
supervivientes de cáncer
on
infantil. Pero no olvidemos
education
que sea
and
comprensible
training
para ellos,
for
que
cancer
sea revisado
survivors.
también y liderado por faros de vida
With the
para poder
assistance of
tener esta
Pauros de
información a la
Vida,
mano y que sea comprensible y ampliamente extensible
to
hacia el resto de la región.
translate
Hemos
this
podido sacar notas de prensa para poner
information
también esto en el
into a
conocimiento de todas las
friendlier
personas que tienen que enfocar
terminology
sus
for the
esfuerzos no
general
solo
population.
en el tratamiento activo, pero que después del tratamiento activo también existen
We want
complicaciones que
people not
necesitan
only to
también
focus
un
on
seguimiento a
the
largo
active
plazo.
side of their
Y
treatment,
en
but
cuanto al
on the
acceso al
long-term
seguimiento,
follow-up as
es
well.
imposible
On the access to follow-up pillar,
es imposible saber realmente dónde
it is
enfocar los
impossible to
esfuerzos si
actually
no
know
sabemos realmente la fotografía
how
inicial que tenemos en la
the
región. Y
if
para esto,
the
de la mano
efforts are having
del
an
programa de
impact
SIOP Global
or
Mapping
not
Program, junto
without
con la
proper
doctora Maite
follow-up.
Gorostegui
So with
y con el
Dr.
SIOP
Maite
Survivorship Network,
Gorostegui,
estamos lanzando un segundo proyecto que
we
es para
launched
tener una fotografía, ver,
project number
conocer
2 to
dónde
have
están
a
estos servicios de
snapshot
seguimiento,
to
justo
better
algún servicio
understand
de
where
seguimiento,
follow-up services are provided,
qué recursos
in which
tenemos y
areas,
en dónde podemos enfocar los
what
esfuerzos
resources they have, and
para
where
poder
further
mejorar el acceso a la atención.
resources
Bajo la
must be
misma
reinforced
metodología
to
del
improve
SIOP Global Mapping Program que ya se
healthcare.
hizo en Latinoamérica previamente, pero en servicios de oncología de activos, nuestra finalidad es
Our
mapear las
purpose
diferentes unidades de
was to
oncología,
map the different oncology
las unidades de
units,
seguimiento a largo plazo
no,
en esas unidades de
long-term
oncología, si
follow-up
existe alguna consulta, si
oncology
existe
units
alguna
throughout the
clínica de
region to
seguimiento a
find
largo
out
plazo,
if
si
there
existe
are
algún
long-term
médico que esté
follow-up
haciendo este
clinics,
seguimiento a largo
if
plazo,
there
no solo
are
enfocado
long-term treatment
en la
physicians
solicitud de
available
pruebas para
throughout
detectar una
the
recaída, sino
region,
también
not
en el
only
enfoque holístico
to
que requiere
detect
este seguimiento a largo plazo,
relapses, but to
que es
have a
sobre todo en
holistic
salud mental
perspective of
igualmente.
long-term care
Creemos
with
firmemente
a
que lo que
main
no se ve no
focus
se
on
entiende. Si
mental
no sabemos
health. health, because we believe that what cannot be seen will not be addressed. Therefore, we need to properly map the needs to provide further follow-up throughout the region. Thank you very much. I know this was a short presentation, but I hope I was able to clearly convey the group's main efforts.
Sean aquellos que están en la foto o aquellos externos, realmente este es una prioridad.
This
Estoy segura que
is a priority, and I am certain
dentro de un poco tiempo
that
primera fotografía, pero
in the short run, in a few years, we will know exactly
y realmente eso es lo grandioso del trabajo colaborativo.
how the landscape is. Thank you very much.
Suad, muchas gracias por el apoyo, muchas gracias a doctora Ana, a Carlos.
Thank you, Dr. Anna. Thank you, Carlos, for sharing such thoughtful resources. I give the floor to Silvana to close the session.
And more participants that connected today in the PAHO webinar to celebrate International Childhood Cancer Day. We hope that we have brought to you new information, new ideas, connected everybody from this great community that we have created throughout Latin America and the Caribbean to help increase survival rates for children with cancer and reduce suffering through our CureAll Americas network, as well as through the global platform to expand access to childhood cancer medicines. You know, we've got this incredible resource, this great network of clinicians, survivors, health authorities, leaders. We've created incredible momentum as you've seen through this webinar in terms of the political support that we have in countries throughout Latin America and the Caribbean, the health system changes that are currently underway to strengthen childhood cancer care, the supportive care, survivorship support, and these tremendous new resources that can help you in your work as clinicians, public health professionals, academia, to really advance care for childhood cancer. So we urge you, please access all of the resources that are available on the CureAll Americas webpage at PAHO. Help disseminate them through your network, your social media, share your ideas of new resources that you would like with us. And please help us work together to really improve childhood cancer care throughout the Americas region. So, you know, it's time to conclude, and I just want to conclude by thanking my colleagues at PAHO, Liliana Vasquez, Claudia Sampur, and all of the PAHO country offices that work with us in the regional office and work with all of the ministries of health and all of our partners to really help implement and develop these new resources and implement childhood cancer care improvements. I also want to thank all of our colleagues at St. Jude Children's Research Hospital. This work would not have been possible without the tremendous technical support, collaboration, and leadership that we receive from St. Jude's. So Suad, Patricia, and the entire team at St. Jude's. And of course, to all of our excellent speakers for the tremendous work that you've developed with us and shown in this webinar. So thank you to everybody. We're going to continue having a series of webinars and developing new resources in 2026. So please stay tuned and join us in our next webinar. And for the speakers, I'd like to ask you to just stay on because we're going to take a quick picture to commemorate this day. So thank you again, everybody, and have a wonderful day.
Thank you, Silvana. So, para los ponentes, si pueden abrir sus cámaras y vamos a sacar una foto muy rapidita, 30 segundos. Si abren las cámaras, abren su mejor sonrisa y lo hacemos en... Sí, veo que están preparando. 1, 2, 3. Saco una segunda para garantizar. 1, 2, 3. Muy, muy lindos. Muchas gracias.
Muchas gracias, Patricia. Muchas gracias a todos y a todas. Que tengan un lindo día. Chao, chao, chao.
Gracias a todos.
Gracias.
Gracias a todos.
Hasta pronto.